You're good to go.
All right, good afternoon. It is 1:01. I'd like to call the SCBC committee to order. As part of a new process, I believe we're going to ask to take roll call of the committee members. So I'm going to turn it over to Carol.
Yep. Yep. So here in person, we do have Bill Oberly, Karen Peterson, and Director Maxwell. Logged in virtually, I have Secretary Gordon, Commissioner Navarro, Deputy State Court Administrator Ashley Tucker, Jeff Tashner, and Controller General Miller. Is there anyone that is logged in virtually that I might be missing? Do you think you could raise your hand? I think that's it. Michelle Gass, are you going to be screen? Thank you. All right. We do have a quorum.
I know Paul had sent an email saying he would not be able to attend today, so we did let us know that. And I believe representation from the Lieutenant Governor's office maybe a few minutes late. All right, moving on to item number 2, which is approval of the April 25th, 2025 SCBC meeting minutes. Hopefully everybody had a chance to review those in advance. I'd entertain a motion to approve those minutes. Sure.
This is Stephen, so moved. Oh,
Hold on 1 second there. Thank you, Steve, but we have a question.
Unless I'm in,
oh, I'm sorry.
Representative Ballback had sent an email, and I thought he had suggested there should be some changes within the minutes.
Did he?
But you do it first.
Yeah, usually we do a second and a motion, then we say discussion on the motion.
I'll move to approve the minutes of April 25th, 2025.
Second.
Okay, we have a motion and a second discussion on the minutes. I think Stephanie's going to take a look to see if there's a correction.
So we did receive a comment from committee member Paul Baumbach stating in the minutes that he had requested a deadline for data revisions to ensure that data could be reviewed in a timely manner, setting the same appointments when requested by Delaware and its agents and auditors. So he has requested to have that reflected in the minutes, which we can add.
Any further discussion on the minutes? So I will ask all those in favor of approving the minutes, say aye.
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 Those opposed?
Aye.
Did I hear a comment? Oh. Michelle?
Yeah, I just wanted to clarify, is the vote to approve them as written or as amended, as requested by Mr. Baumbach?
I believe we can, it was to accept that correction and see there was anybody that was and not in favor of that, so we can have the amendment amended if you like. Is that necessary?
I would move to accept the minutes as amended by Representative Ballback's comments.
Second.
So we do have a motion and a second, and the motion, just for everybody's clarification, is that the minutes would reflect the comments made via email and read in by Stephanie into the record today. So that's the motion. Can I, all those in favor say aye?
Aye.
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 Those opposed?
Aye.
None opposed? Anybody want to abstain?
Abstaining, Ashley Tucker.
Do we have that?
Yeah, Ashley Tucker. Yep.
Okay, I believe the minutes have passed. Thank you so much. All right, next on our agenda is statewide benefits office director's report, and I think this will be the last report for Ms. Rentz.
Thank you, Director Maxwell. Good afternoon, everyone. So I'd like to start out today just by sharing an update with regards to the life insurance request for proposals. The submission of proposals has closed, and we have 3 bidders in this process. The first being MetLife, The second being the Prudential Insurance Company of America, and the third being our incumbent life insurance vendor, Securian Minnesota Life Insurance Company. All of these vendors have submitted proposals that include pricing for all four of the options that were outlined in that request for proposals. With regards to the 2025 open enrollment, this would be for plan changes and plan years effective July 1st. The statewide benefits office does plan to provide detailed enrollment changes to the committee at the July meeting. But in terms of overall employee participation compared to last year, we saw just under a 1% decrease from the prior year, with the enrollment participation being 83.3% this year compared to 84.2% in 2024. Just to close out a couple of changes with regards to those plan years starting July 1st, I wanted to share with the committee that there are a number of preventative schedule changes going into effect on July 1st. None of these changes impact pharmacy preventive services. However, Aetna and Highmark preventative schedules will include a couple of changes, specifically including coverage for ovarian cancer monitoring tests for women treated for ovarian cancer and annual screening tests for women at risk for ovarian cancer. These changes are in accordance with House Amendment 1 to House Bill 16. And then further, Aetna and Highmark schedules will incorporate coverage for diagnostic breast examinations and supplemental breast examination, screening examinations, that is, subject to cost sharing requirements that shall be no less favorable than the cost sharing requirements applicable to screening mammography for breast cancer. This is in accordance with House Bill 60. Both of those bills were passed in the last session of the General Assembly, and they are effective for the group health insurance plan on July 1st. Just as an aside, and this was shared previously with the committee, the estimated fiscal impacts to the group health insurance plan for those two pieces of legislation are $100,000 for House Bill 16 and $275,000 for House Bill 60. Lastly, Highmark will be making changes in their preventative services schedule to also include the removal of any prior authorization requirements for lung cancer screenings, as well as the addition of coverage for the polio vaccine for adults never vaccinated or with incomplete vaccination. Highmark will also be applying these changes to their preventive schedules applicable for their fully insured book of business. Those changes as well will go into place on July 1st. With regards to those last two changes in the Highmark schedule, there are no estimated fiscal impacts to the group health insurance plan. Moving forward, there are going to be some drug formulary coverage changes going into place effective July 1st. CVS, our pharmacy benefit manager, has shared with the statewide benefits office upcoming changes impacting the commercial plan formulary effective July 1st. These changes will include the exclusion of the GLP-1 weight loss drug Zepbound. The preferred options for GLP-1 drugs for weight loss will be Wegovy and Saxenda. This change is part of CVS Caremark's strategy to help create lower costs while maintaining coverage options under the different therapeutic classes to ensure the lowest net cost on GLP-1s for plans that cover weight loss medications. CVS estimates that this change will help create a year-over-year client savings in the range of 10 to 15% in the anti-obesity medication space. Specific to the group health insurance plan and with regards to that exclusion of Zepbound, we currently have about 2,200 members that are taking that drug that will be obviously impacted by the change.
CVS has initiated outreach and is notifying those members, as well as the options available to them, which are basically that they can switch to a preferred formulary option. They can request a formulary exception due to medical necessity, or they can utilize third-party discounts and/or copay assistance to bring down the cost of those medications that are not on the. The last plan design change that I wanted to make the committee aware of is with regards to the IMED vision plan. Following the SCDC's approval at the March 21st meeting of a couple of enhancements to the vision benefits for July 1, the benefits office was made aware of additional plan design changes that will also be effective July 1, specific to these benefits. These changes are specific to out-of-network reimbursements, and they are required to ensure compliance with a new Delaware Department of Insurance requirement that the differential between in-network and out-of-network be no less than 50%. So as a result of this Department of Insurance requirement, the changes do not require approval by the SCDC. However, they will be incorporated into the IMED plan documents and overall will result in an increased reimbursement whenever a group health insurance plan member obtains frames, anti-reflective coatings, and/or retinal imaging from an out-of-network provider. Yes.
Commissioner Navarro has a question.
Yes, Commissioner Navarro.
Oh, I can wait till you're done. It's
No,
about-
actually, that's the end of additional plan design changes happening for July 1st. So I was actually going to pause there to take any questions from committee members.
Perfect. Can you hear me okay?
Yes, we can.
Yeah, I'm having some camera issues, but so with the Zepbound and CVS's desires to change that formulary or remove it, and I know I probably already know the answer to this question, but I, like many others on the SCBC, have been receiving a number of comments from our coworkers who are really upset about this change. You know, Zepbound's different from Wegovy and the other GLP-1 drugs. Not every one of these types of biologics work the same. I mean, I know there's similar ingredients, but you know, I don't know what the number is of state employees. Maybe you did say that. I was trying to keep notes. But you know, it's really disappointing that this is happening again. You know, this happened, I think, at least the third time. And I think the first time was with Express Scripts, but at least the second time with CVS. And it's, you know, these types of drugs have to be special delivered. They have to be refrigerated, you know, and I would rather see a physician make this decision rather than a PBM. And I guess maybe, like I said, I think I already know the answer, but when you mentioned earlier a 10 or 15% savings, what does that mean in dollars? That would be a little easier for me to comprehend. Thank you, Faith.
Sure, Commissioner. So I did mention the member impact. It is at slightly over 2,000 members, so that is significant. That's a large number of our members. You know, just as a reminder to the committee, I know we're going to be talking a bit more today about the scope of work for the upcoming pharmacy benefit management request for proposals, but you know, currently the state's contract for pharmacy benefit management services allows or sets forth that our participation will be in this PBM's standard control formulary, which essentially means, you know, we're deferring to the PBM for formulary changes. Over recent years, those changes have become quite frequent in an effort for the PBM on behalf of clients like the state of Delaware to best manage and control their costs. Now, what that doesn't mean is that those formulary changes will result in members not having access to drugs in any particular class. So there's always an alternative when these changes occur. And again, we recognize this is a big change, impacting a lot of folks, but there are going to be other options on the formulary for them to continue to have access to GLP-1 medications. And at the same time, result in savings to the state, who is, again, paying the majority of the cost for these and then other medications that are available to our members on the formulary. In terms of actual client savings, Stephanie, I don't know if you have a better ballpark of what that translates to specific to the anti-obesity class, you know, in the 10 to 15% range, if you've got a dollar amount that you could throw out there. If not, we could follow up.
Yeah, absolutely. We can very much follow up with CVS. That 10 to 15% anticipated savings is across all of their clients. It's not a number that's specific to the state of Delaware, and does, to my understanding, include the impact of rebates as well. So we'd be happy to follow up with CVS to get exact or estimated dollar savings projections from this change. But again, that estimate is across their entire book of business. It's not specific to the state of Delaware.
Which means that we may see no savings.
The understanding is that it would resolve in some, if not significant, savings. But again, I can get those exact dollar estimates for you as well and share with the full committee.
Yeah, what concerns me is that many of these PBMs have a relationship with the drug manufacturer, and the drug manufacturer decides what drugs they want to put in based off of what drugs they versus other manufacturers make. And so, you know, I hope that in the next process that we could, you know, it's our program, right? It's our plan that we could put in the RFP that they can no longer do this. And I know that coworkers can file appeals. There are options for folks to perhaps stay on this drug through that appeals process, but it's not an easy thing. And I'm disappointed that it's continuing to happen. And I think this has been at least the third time. Thank you.
Karen Peterson.
Yeah, I missed the very beginning of Commissioner Navarro's question. My question could be the same, I apologize if it is. So do we know if this is actually a savings, or is this a case of they can get a better rebate with another drug?
So with the current, Stephanie Hardis, Statewide Benefits Office. With our current plan structure, the state receives 100% of all rebates received. So in the instance of your question, the results of this being potentially an increase in rebates to the state would result in additional revenue to the state, lowering the net cost of the drug.
Okay, do we know, is Zepbound more expensive than the other GLP-1 drugs?
We can take that back to get the net dollar amount. Again, that's not considering any type of rebates, but be happy to share that with you.
Okay, and as Commissioner Navarro said, people can also appeal that, right? If that's the only drug that their doctor thinks works for them. And we ran into this with the question of woman with the drug, thyroid drug.
Mhm.
And they had pulled the only drug that treated her condition off the formulary. And I know she was able to appeal that. And would people be able to appeal this if their doctor feels that this is the appropriate drug?
There is what is known as a formulary exception process, where their provider will submit documentation to CVS to justify why they cannot take what is now the preferred drug on the formulary. And if, you know, that documentation supports that request, then they would be permitted to continue on the non-formulary medication.
It's Director Maxwell, is there a transition period? Like, would they have to come off that drug to allow for that process to see itself through? Like, is there going to be a disruption for that person?
Typically not, because that is an accelerated process, keeping in mind that, you know, it would have impacts obviously on the member if they were to have to discontinue the drug for any period of time. And keep in mind as well, these communications, I'm sorry, have already been sent to impacted members to give them that runway of time to figure out, you know, if they want to explore any of those options available to them and work with their treatment provider. Historically.
Hold on.
That's okay. I'd just like to recognize Lieutenant Governor Kyle Evans Gay has joined us, and also we have our special guest who's arrived, Senator Sabrina, but we'll continue with the questions.
Yeah, just Bill Oberly, just one quick question. It impacts the commercial market. Is it only for weight loss purposes, or does it impact those that are taking Zepbound for diabetes?
It is specific to those taking it for weight loss. Any other questions with regards to those changes? I do have a couple of additional updates. Moving ahead, as we have concluded our open enrollment for the July 1 plan year, the benefits office, in partnership with the pension office, has also set the dates for the 2025 state of Delaware Medicare open enrollment. That open enrollment will run from October 21st through the 31st of 2025 for the plan year effective 1/1/2026. We plan to provide more details on the planning and communications with the committee at the August. Just wanted to give a heads up on that. As it relates to the status of contracts and amendments for benefit programs and services, we did provide some updates on this at a recent meeting. The benefits office continues to work through negotiation of new contracts with Securian for accident and critical illness, Health Advocate for employee assistance program services, and ASI for flexible spending, pre-tax commuter, and COBRA administration. Those are all effective July 1st. We are also continuing work on amendments for optional renewal years for other benefit programs. Our goal continues to be to complete that contracting process by the end of June. Legislative updates. In the interest of time, I just want to make the committee aware that the benefits office is tracking and following legislation introduced to date in the 153rd General Assembly and related to health benefits and healthcare administration. Those bills include Senate Joint Resolution 7, which we will hear more about shortly, House Bill 163, Senate Bill 12 with Senate Amendment 1, Senate Bill 117, Senate Bill 120, Senate Substitute 1 for Senate Bill 134, and House Bill 56. In July, the Benefits Office will provide a detailed report out to the Committee on Legislation.
Lieutenant Governor.
This is Carol V. speaking. The list that you just shared with us, does that differ in any way from the list that was sent via email for us to review?
It does.
Okay, thank you.
You're very welcome. With regards to the SCBC work plan, while that has not been included on today's agenda, I just would like to encourage members to please submit any topics or requests to either Stephanie Hardis or Kristen Short, who we will introduce momentarily for discussion in a later meeting. And then in conclusion, and with regards to follow-ups from your April 25th meeting, for transparency purposes, I just want to report out that committee members were confidentially provided with PBM administrative fee reporting for the CVS Caremark commercial and SilverScript employer group waiver plans, and also an analysis provided by CVS of non-specialty generic drug costs under the CVS commercial plan. This was comparing those costs to the Mark Cuban Cost Plus website. Again, due to confidentiality, the information contained in these documents, due to the information there being confidential, we are asking you to refrain from any public discussion on those documents. And if I could, I'd like to just allow Stephanie the opportunity to do some quick introductions. Kristen.
Sure, thank you. So I'm very happy to introduce everyone to Kristen Barnacope Short, who is our new SCBC and SCBC subcommittee manager. As you all know, this is the last day in the position as she is retiring from the director role. As I move into that role starting next week, Kristen will be moving into my role. And she's actually, some of you may already know her, she has done significant work with the Retiree Healthcare Benefits Advisory Subcommittee and is very familiar with the work of the committee. So we're very happy to have her on board.
Thank you, Stephanie. Welcome.
Mr. Chairman. If Faith is finished, I'd like to just take a minute to say that over the years, Faith and I have been on different sides of some issues along the way. But I have to say that never once did I ever question your integrity or your competence or your sincerity. And I just want to congratulate you on the 30 great years with the state, and you will be missed. So thank you, Faith, for all your good work.
All right, so with no further ado, I'd like to move to agenda item number 4, where we have special guest Senator Siegfried here to kind of give us an overview of Senate Joint Resolution 7. Turn the floor over to you, Senator. Thank you. If you want to sit in my seat, that's fine. That way people online can see it. Oh, yeah, you can chat in front and center here. Thank you.
Good afternoon, everybody.
Good afternoon.
So what I'd like to do today is to give you a little bit of background on myself, because I think some of you may know it, others may not, and then give you a little bit of background on why I presented Senate Resolution 7. And I'd like to kind of walk through the 9 recommendations.
Right over here.
Right here. I feel like I'm on the floor. The 9 recommendations that I have in here and kind of talk about this. And first of all, I recognize I'm coming in at, probably 11:30 of midnight. So I know it's kind of late, but, unfortunately, I've only been in the Senate for 3 months and I really wanted to move ahead with this. So first of all, my background professionally has been totally in healthcare as an executive at Christiana Care, then a full-time professor at a university teaching healthcare policy as well as healthcare reimbursement. I was a state representative where I was a vice chair of the healthcare committee. And now I find myself in the Senate on the healthcare committee amongst many others. I think it's no secret that pharmaceuticals are really very, very special in terms of negotiation. All of you should know by now that in the year 2024, the state spent $508 million. This year's estimate could be, significantly more than that. If you look at the state budget, the recent budget benchmark indicated that we are about 416 million, a razor thin positive margin. Yet to understand about the federal dollars that fund, of course, Medicaid, housing, and many other vital social programs remaining still at risk. We have no idea whether they're going to be funded or not, or cut back or whatever. And let me just say this, that I will be the first one to certainly acknowledge the praise of pharmaceutical manufacturers for their many products that they produce, which advance public health and promote cures to various diseases. They're to be commended because of that. But concurrent to this advancement exists, unfortunately, a very dark side. Deception marketing practice surrounding the opioid painkillers. I think we all understand what happened with that. I certainly do. I was in the hospital listening to these salesmen talk to physicians. Decisions by the Federal Trade Commission to block mergers of drug makers that would have created monopoly power over certain medications. All of this added together, and the knowledge that I have about pharmaceutical and the certainly the PBSs, kind of was the genesis behind Senate Joint Resolution 7. And in this, I'm hoping that all of you have had a chance to look at that resolution. Okay. There's really, I would highly recommend you have kind of 2 paths to attack not only the cost, but the quality of pharmaceuticals. One, I would label as the classic supply chain strategy, which is to focus on price. And the other one is to gain accountability over pharmaceuticals for comprehensive control. And let me just explain to you what I mean by that and kind of go through and walk through some of these recommendations. So the first one that I have down here is to own and control all necessary pharmaceutical data. And that to me is critical. That's that latter part about trying to gain control from an accountability point of view, as opposed to having a PBS, whether it's CVS or whoever, tell you on a quarterly basis, here's what you purchased. And oh, by the way, at the end of the year, I'll give you a rebate count, which you have to reconcile somehow, whatever you want to do. That to me should really stop. I mean, I think somehow, some way, we have to invest in the control of this information and really look at it from a transparent point of view. So that to me would be number one. Number two is the creation of this independent pharmaceutical and therapies committee. Now, let me explain, and the commissioner mentioned a little bit about this, I believe, when he was talking earlier. So historically in hospitals, they are regulated really to have a pharmacy and therapeutics committee. Such committee is made up of pharmacy individuals and physicians, and they look at medications not only from a financial point of view, but also a clinical point of view. And they create out of that committee what is known as a formulary, which the PBSs have done for us, and they've created the list from us to choose from. What I would love to see us do is to create a pharmacy and therapeutics committee independently, solely on behalf of the state, who will focus not only on a breadth of different customers, but on us only, one source. I think that would go a long way in preserving and understanding what we have and what we don't have. And during the period of time that we're working on these pharmaceuticals, be in more engaged in terms of changing from, drug A to drug B for clinical and financial reasons. Point number three, and this is kind of the beginning of the negotiating strategy, the reverse auction, which I have, I think it's Senate Bill 134, which is before the House right now for approval. So that prior to this, a service department or organization couldn't use this concept to negotiate for their services or product. This legislation, though limited, I agree, Karen, it is limited to just the product of pharmacy, does offer an opportunity to try to save money on what I would call commodity pharmaceuticals. Because when you look at the breadth of pharmaceuticals, and I think you've already talked about this, that there's a balance between the price of the widget, right, the price of the product, and the quality of the service. I think both you have to look at. And some products, whether they're generic or brand name, could go into this bucket, but I think you always have to balance those two factors. So whether it's reverse auction or a transparency subcommittee that will really focus on trying to unravel the breadth of information, again, that's a focus on the price, which is great. But in my mind, you also need management and control over the products that you have. Number four, what we'll certainly need more legislation, and that's the opportunity of an interstate compact with other states for high-end price drugs, which we could lever from a economics scale point of view and go directly to a manufacturer and negotiate our volume. Even though it's $500 million nationwide, it's kind of a drop in the bucket to the manufacturers. So we're going to need that extra, volume to really make a difference. Number five, the state should pay no more in price than what the federal government has negotiated for Medicare. Now, I will tell you that I've already had pharma come after me on this one, basically saying that they can't do it because apparently they have some kind of a clause saying that this is only for Medicare and states can't use it. Well, I would like to see a copy of that. And I'd like the public to know what's really going on here, because if they've negotiated for this, and thank God for Biden, who made this happen, I think that price should be available to all of us. Why not? I mean, I don't understand why it's not. And if it's not, I want to see the legal document. I think that'd be very interesting. So the other thing too is the PBMs. So the state should really request, I know you've done this in the past, but the complete administrative expense for all pharmaceutical drugs contracted. So in other words, they get money from the manufacturers for doing a whole host of things. And let me just stop here and suggest, so all of you must know, rebate spread. You understand what that is, a rebate, and they kind of spread it out. So they keep a little and they give a little to the pharmacy that they contract with, and they give a little bit to the customer, but they keep some of that as revenue, right? But how many people here have heard of AWP spread? You know what that is? Okay, great.
I didn't know it was gonna be tested today, Senator.
Sorry?
I didn't know it was gonna be tested
Oh,
today.
sorry.
That's all right.
It's great
But
committee.
I've got ahead of the class, Senator Peterson to answer for us.
There you
so.
go.
You didn't study for the meeting today.
I didn't study in advance.
That's great. Well, anyhow, that's another way that they earn money, and that is where they take the price of the product and they subcontract with a local pharmacy, but they don't pass that price on to them, and they take some of that money. And it goes on from there. There's administrative fees from the manufacturer to a PBM to manage some of the rebates, and it goes on from there, a whole bunch of different ways that a PBM makes money, of which their customers rarely understand or know or have knowledge of about how they make money, and we should have that right to know. So that's just another thing. And the PBM's contractual agreement with manufacturers. I mean, I think we need to know that. It was said before, I think the commissioner mentioned that, we don't know whether the manufacturer is telling the PBM, push this medication for whatever, and, you'll get a higher rebate. Is that true? We don't know. We have no knowledge of that. So that's very important. And my last point here is this idea of the right to audit. And I think Reagan said it well, trust but verify. And I think that's exactly what this committee should be going after. I think we do have to verify. We have to verify regardless of what they push back or they say to us or whatever. What they're doing is just not transparent, period. And, here we are dealing with, at least, $500 million worth of taxpayers' money. We have an obligation, both morally and financially, to make sure that that money is spent wisely and that people get quality products from the pharmaceutical companies. So, in the end, and I recognize that the contract will be made real quick, and I realize that you're going to be negotiating. So what I am asking you to do is to really consider all of these. Some of these I realize will be very difficult, but I think you got to keep on pushing until you get an answer. And at the end, in August, creating a kind of feedback mechanism, a report to the Senate and the House and the governor regarding what happened. Did it work? Did it not work? Why? And things like that. Because I think this is going to be an ongoing issue, something that we need to really continue to fight for. So I've made a whole bunch of words, and I don't know whether you agree or disagree or whatever, but I'm just saying that from my point of view, in my experience, this is really a tough thing to do, and I have a lot of respect for what you're doing and everything. I'm trying to do as much as I can to be behind you, to push, and to be shoulder to shoulder with all of you and fighting for this, because I think it's very, very important, very important. So I want to thank you for the opportunity of presenting to you and wish you the best in negotiating.
Okay, Senator.
Senator, thank you for your interest and thank you for putting this legislation forward. I'd like to allow the opportunity for any committee members that might have any questions. Not every day we have a state senator join us with legislation that's going through the legislature at this time. So, Bill Overly?
Yeah, first of all, Senator, thank you very much for your efforts on this front. I mean, it's, I think it could be very helpful. And when I went through the resolution, and I shared this with Stephanie Hardos earlier, that I kind of see it as a framework for negotiating what the RFP ought to look like for the PBM contract. Now, how much of that we can fit in the time frame, right, is left to be answered. However, you know, a Senate joint resolution, assuming it passes the House and is signed, has the effect of law during the period the General Assembly is in session. So, and this articulates that we shall consider these things. Right. So I hope that you know, at least from a SEBC perspective, that we do consider each one of these items and again see how the puzzle fits together within the RFP moving forward for the PBM. So I appreciate your effort. Thank you. Yes, sir.
Yeah, Governor?
Yep. Well, first of all, I just want to compliment Senate District 5 for obviously, just having, great senators as far as I can tell. But I wanted to thank the senator for the dialogue with the substitute. I appreciate you were incredibly receptive, not only to framing these as, like you said, shall consider, so that we have a framework, but also maintain the level of independent thinking and dialogue at this board that we're charged to do, but also in thinking critically about the report date and making sure that that report will be at a time when we've had a chance to really take a look at everything that's included in the SJR. So, as someone who's formerly served and was disappointed by some of the dialogue at different times, it's been my goal to make sure that we maintain that dialogue. So to you and to your colleagues, please let them know that we would like to have open and frank conversations and start to understand what the priorities of the legislature are. It's a long list. It's a tall order. But I'm optimistic that we will be considering with an open mind many of these ideas and others that are brought to us, and where we land. I know we're all going to be focused on making sure that we can do the best on behalf of the employees. So thank you.
Thank you. Yeah.
Mr. Chairman?
Yep, Karen Peterson.
I just want to follow up with, and I also appreciate all of this. I know you put up a lot of thought into it, and I appreciate that. My concern is one of timing. We have here the draft PBM. I have no idea if any of this is in there, or all of it's in there. I don't know. And I know it has to be finished by June, by our June meeting, correct? So I'm not sure how we get all that done. Look to our fearless leader over there, see if he has any ideas.
Can I jump in? Is that okay? Sure. Fearless leader. Senator, this is part of the conversations that the senator and I had. And I think that what is really great about the resolution is that it is it is broad enough to think about all the spaces we would like to go, where the General Assembly is saying they might want to go. But it allows for a mechanism, if we can't do it in this time period, in this cycle, to say why. So for example, in the report, Senator Siegfried's resolution asks us to say, if we can't do one of these things, why not, or how did it fail? If it's merely because of timing, I think that's a fair thing to go into the report. And I think Senator Siegfried's charge is to say, well, what would you do next then? And I think this type of official dialogue allows us to think about it for ongoing contract negotiations too. But in my view, and Senator, you might disagree, I think simply stating there was a timing issue this year, but we can continue to take these things under consideration would meet what you have charged us to do under the resolution.
Yeah. So I would have just said that had our lieutenant governor somehow ran for her office earlier, I would have had more.
Yeah, exactly. That's totally fair.
I'm able to do that. I understand. But no. So this is not a hammer. This is an idea, and I personally think it's, based on fact and my own experience in healthcare. And, I recognize that, the timing is very short. You're looking at the draft of the finished product and everything, you may or may not be able to. But, perhaps in the negotiation, we could do that, or perhaps, I don't know whether, you have flexibility in other, considerations that you could maybe squeeze in and during your negotiation, say, bring this up or bring that up or whatever. And we all know, I mean, you've been through this 100 times. They're going to say no, 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 no to everything, right? You know that. And that's part of the problem, that they're not transparent, the PBMs. And now it's even getting worse because CVS is, integrated with, they're actually buying hospitals, and they're looking at integrating with pharmaceutical companies. So it's like, who's on first? You can't even tell, so it's getting crazy. So, but whatever you can and however I can help in addition, I'm here for you.
Thank you, Senator. We definitely have a tight agenda today.
Got it.
We do appreciate you coming
Thank you
out
very
today
much.
and an opportunity to ask you a few questions, but thank you so much.
Sure. Thanks so much. Appreciate it.
We're gonna move on to agenda item number 5, 5A, audit services RFP summary and recommendations. I think we have Michelle joining us virtually to go over that.
Mr. Chair.
Oh, 1 second, Bill Overly.
Yeah, before we go on, and I hate to slow the process down here, but I'm trying to figure out how to get from A to B in terms of the what is laid out in terms of recommendations in this joint resolution. Is we have a proposed RFP for the PBM. I don't know how much of these ideas, how many of these ideas are contained within that RFP. Is there a way that we can engage with Willis Towers Watson to share at least these ideas so that they can go back, see how many are addressed in the current proposal and how many can be added in an amended RFP? I mean, I'm just kind of at a point where I don't know how to get from A to B. And it seems to me that Willis Towers Watson has to be involved in this process. We've expressed an interest in these, the legislature has. I think there's probably a consensus among the members of the SCBC. So I'd like to see Willis Towers Watson pursue this, see how many of these ideas we can incorporate into the RFP.
Yeah, so
I just went through, I'll be honest, I didn't go through the entire RFP. I tried. I spent 2 nights online and didn't get through the entire thing. I don't know if there's overlap between what's recommended in the joint resolution, whether some of these are contained or whether they're not. But I'd like to see as many that are feasible worked into the RFP.
Okay, so like I'll echo the Lieutenant Governor's comments in that what the senator presented to us is a framework and there's flexibility.
Right.
And so if you need peace of mind as to once we get through our draft and what we're going to actually issue as an RFP, as to like a checklist of what we were able to incorporate, I don't think that's an unreasonable request. And I turn to Faith to make sure I'm not, or gonna be Stephanie in this case, not overcommitting, but I think that would be a fair assessment. And what you have before you today is just a draft, and there's gonna be probably numerous comments of suggestions of how to make that document better than where it is today. And so I look forward to that discussion.
And I would agree with that, but I guess what I'm suggesting is that we use this joint resolution as a roadmap to incorporate as many of these ideas into the RFP as we can possibly do.
I get it, but like I said, it's a framework, and to I think Lieutenant Governor, when she had her discussions with the senator, is like, we're charged with a task. We appreciate the interest and we're gonna try to fit as much as we can in there. But given the timeline, I can't guarantee you we're gonna be able to squeeze, 10 pounds in a 5-pound bag right now.
I appreciate that.
Lieutenant Governor?
30 seconds, really, and the other, just so that we're all on the same page. The resolution includes both RFP relevant charges and then also some contract negotiation charges, and then some that are interstate compact related that may be a third type of, right?
Yeah,
So I think there's actually fewer pieces than the full list
correct.
that we might have to, so I'm optimistic about the amendment process.
And I don't disagree with anything that you said. The other question I had is in terms of the contract length. Since this is a project in progress, is there a way to shorten the length, say to a 1-year contract with an option, or is that?
We're gonna talk about that. You're jumping to the.
I'm sorry.
It's on here. We're gonna talk about C.
I'm just trying to look.
I gotta put you on ice for, we're gonna put you on ice for a couple of agenda item, numbers, and then we'll get back to you. okay?
Gotcha. Yes, sir.
All right, turn it back over to Michelle.
Good afternoon, everyone. I'm Michelle Gast from Willis Towers Watson. I am going to present the request for proposal summary and recommendation from the PRC for the medical and prescription insurance audit. Sorry, there we go. So the contents of our discussion today are focusing on giving some background to the group on where we are today for this specific RFP. So that's the context for today's discussion. So what has been completed so far and what is to come for this specific RFP. A summary of the background and process for the medical and prescription insurance audit services RFP, the high-level objectives, the timeline, review the actual recommendation from the PRC, and discuss next steps. So first, focusing on the context for today's discussion. From a background standpoint, the state of Delaware has been working with Willis Towers Watson to assist in a request for proposal, or RFP, to evaluate the vendors for an audit of the state's medical and prescription drug plans. The SCBC conducts procurements for each benefit program every 3 to 5 years, and this includes the professional services such as claims auditing, which is the RFP we're discussing today. The contract for the medical and prescription insurance audit services was last procured in 2020. So at 2025, this is the time that the state would normally conduct their next RFP. The Proposal Review Committee, or the PRC, as I will refer to them throughout this presentation, consists of SCBC members or their designees, and this group was established for this RFP. They have met several times over the last several months to review the proposals that were sent in from the vendors, to interview and evaluate the finalists for this RFP. They then were explained how to work through the scorecards and were scoring the vendors based on the discussions they had as a group. They then went through those scores together and worked together to formulate the recommendation that was sent to the SCBC in advance of this meeting. So in preparation for today's discussion, the SCBC was asked to review that proposal that the PRC has prepared for them, which summarized the information and findings, as well as the recommendation that will be put in front of the SCBC to vote on today. The SCBC will be asked to vote and approve on the recommendations today so that contract negotiations can begin. Some of these slides, and just conscious of time, we have reviewed in the past, so I'm going to try to summarize them as much as I can to keep this moving. But if anyone has a question, please raise your hand and I'm happy to address it. From a background standpoint, the medical insurance audit will be conducted for 5 medical plan options administered by Highmark and Aetna, plus the services by Lantern. The prescription insurance audit will be focusing on the commercial or non-Medicare, as well as the employer group waiver plan, or EGWP, which is Medicare specifically. The current contract for medical and prescription drug audit services is with Claims Technologies Incorporated, which is a division of Brown & Brown Insurance Services. We will refer to them as CTI throughout today's presentation. They have conducted audits for the state since fiscal year 2015, following the 2015 RFP that had expired in 2020. And then in 2020, as I mentioned earlier, this was also put out for RFP, and Brown & Brown, which is then CTI, has been conducting the audits for the state since that time. During discussions with the SCBC over the last several months, and into last year, of course. We gathered feedback from the SEDC as well as Willis Towers Watson, working with the SBO to understand what areas we'd like to explore with this RFP in comparison to the last time it was conducted in 2020. This next slide, I know we've gone over this in the past. I'm not going to go into too much detail here, but happy to answer any questions if there are any. This covers a detailed description of what is currently audited for the state. This is specific to the medical insurance audit for the 4 plans currently, but it will expand into Medicare Supplement and Lantern with this RFP. And then from a prescription audit standpoint, it's focusing on commercial and EGWP. So that's non-Medicare and Medicare being audited as well. A lot of the services that are listed here are consistent across both, but where there's differentiators, we tried to highlight them for the group. From a high-level RFP objective standpoint, some of these are consistent with other RFPs, and then some are very specific to the audit RFP, so I'll try to focus on them because, again, I'm conscious of timing. The ability to conduct a medical and PBM contract compliance review, including statistical control measures to review Highmark, Aetna, Lantern, and CVS's policies. The financial and administrative, having competitive administrative and financial guarantees, managing the timelines within the RFP that are documented, and making sure to have as minimal involvement from the SBO as possible throughout the review. Demonstration of extensive experience administering the scope of services with the vendors that were listed. So specifically, we wanted to make sure that the vendors that would be conducting the audits for the state have experience working with the vendors that are here for medical and PBM specifically. So we asked questions around Aetna, Highmark, Lantern, and CVS to understand, the number of clients they've done audits for with those providers and what their relationships are with those providers as well. The second to last one here is focusing on, I would say, a standard that's across all of the RFPs for the state, making sure that they have submitted all of the requirements for the bid. They've included compliance with the format, clarity, making sure the responses are clear and complete, and during the requested time that is conducted during the process. And then a big item here, I would say, that was newer for this RFP in comparison to 2020 was focusing on understanding the difference between traditional versus real-time audits, as well as understanding the pros and cons of both approaches. The next slide, I go into, I'd say, a little more detail around what specifically was new with this RFP in comparison to the last. And again, this was based on discussions with the SEDC and what information they were looking to make sure was included in this RFP. So specifically, the first item is that Medicare Supplement will now be included as a part of the RFP. The second item is the Lantern and Prudent RX in prior audits. This was specific to Aetna, Highmark, and CVS, but it did not include Prudent RX for CVS, and Lantern was not included as a part of the audit. In the past as well, there was the inclusion of the commercial and EGWP plans for the PBM audit. However, there wasn't enough clarity around what exactly was being audited. So as a part of this RFP, we added detail with the SBO and hoping the SEDC were able to see that detail in the RFP itself to ensure that those the clarity that was required there was incorporated into the RFP, and the vendors were allowed or enabled to provide feedback on that as well. The next bullet is specific to the PBM requirements under House Bill 219 of the 151st General Assembly. This is ensuring there is a requirement around brand drug claims process in the state of Delaware using the National Average Drug Acquisition Cost, which is known as NADAC, pricing. And then there were questions during discussions about understanding if there could be additional hours, for example, on the prior slides where I went over what is currently conducted audit-wise for PBM and medical. The SEDC was questioning the number of hours, for example, post-audit, where the auditor supports interacting with the PBMs as well as the TPAs, could there be an increase to this? Would there be an additional cost? So we consider that in this RFP as well.
Question, Bill Oberly?
Just one question. When I went through the documents, it kind of jumped out at me. Were we previously auditing the Medicare supplement plan?
No, that was not a part of the 2020 RFP. That is new with this RFP.
And we were not auditing the EGWIC RX plans either.
No, we were we were auditing commercial and EGWIP plans, but the clarification around the detail of those audits was not clear. So
Okay.
what was a part of this RFP was making sure there were clear rules to what the state would like to see covered in the audit for both commercial and EGWIP, but they were included. It was just not very detailed.
Okay, and the other note I made was around the NADAC pricing. Can you give us some sense of what that practically translates to?
Can I put you on the spot for that, Brian Halloran or Kristen McKee on the Willis Towers Watson side? I
Yes,
feel like
so
you'll
the,
speak to this better.
yep, hi, this is Brian. For the national average drug acquisition cost, that is like a publicly posted listing of kind of the average price that retail pharmacies pay for prescriptions. So as a part of that legislation, the retail pharmacies in Delaware are reimbursed using that kind of pricing model instead of the AWP minus pricing model that we see otherwise.
So at least that would provide us with some baseline in terms
Yes.
of.
Oh yeah, it's a baseline to ensure that it's not egregiously priced or anything like that. So in line with what we're seeing in the market.
Appreciate it. Thank you.
Question,
Sure.
Steve?
Yeah, just a quick question. I'm curious on what the auditors use as the basis of the audit. Meaning, are they looking at the contract? Are they looking at other issues? For example, and this is just by example, if in the PBM there was a description of how rebates and how many rebates go to the state, is that something the audit would look at, and what percentage of those rebates don't go to the state, or is that more of an analytics function of the program itself?
Brian, I was going to let you speak to that as well. Sorry, it seemed about the rebate specifically.
And that was just an illustrative example. I'm just trying to.
I'm sorry about that. It cut out for me midway through. I hate to make you repeat it, but could you go through
Yeah,
that real
I'm
quick?
trying to figure out what the auditors look at when they are doing an audit on any of the services. So.
Speaking to any, sorry, I can speak to high level. I thought you were focusing specifically on rebates, which was why I referred to
No, I gave
Brian.
that as an example. All right.
Okay.
So for example, will they be looking at, for example, the amount of rebates and how much they actually passed on to the state, or some of their performance requirements and whether they met those performance requirements, or is that beyond the scope of the audit?
I can answer for rebates. Typically what happens is the auditor pulls the contracts between either the rebate aggregator or the PBM and pharma and does an on-site review to ensure that the rebate, as stated in the contract that's being passed to the PBM, is passed 100% back to the state. That's the typical practice. Michelle, I'm not sure specifically with this audit if it's done differently, but that's how we perform a rebate audit. And as far as the discount guarantees, if they're based on AWP pricing, what happens is the auditor will look and ensure that the discount that was actually achieved for the given time period matches what's contained in the contract, and that everything was reconciled properly at the end of the year. And if there was a shortfall, that it's made up for. If there was an overage, that it was properly captured. Yeah.
Okay, so it's all based on the contract. That's
Yes.
kind of
Yep.
the gist of my question. Thank you.
Yep.
Yeah, and I was gonna just add Stephen to expand on this slide specifically. So some of these, like first items here, the electronic review of claims, the target claim selection, they are doing a very detailed review of, so the electronic, for example, the auditor is taking all of the plan rules, like all of the information in your booklets, the SPDs, programming that in their system and running the claims through to ensure that what was done by the TPA in this example was what actually happened, testing it in their own tool. That, of course, is relying on the auditor programming it exactly correct. And then the second item, the target claim selection specifically, is where the auditor actually looks at the outcome, but through the vendor's eyes versus it being in their system to check.
Yeah, and
So
one
the
final question.
vendor
One
walks them
final
through.
question. In Medicaid, as you've probably been reading across the country, and Medicare, there's been a lot in false claims and upcoding and things like that. Is that something they also look at?
I think so, but I think that's a really good question for the additional detail there. So I'm happy to take that away and clarify for you.
Okay, thank you very much.
Yeah, no problem.
Jeff Tashner, you have a question?
Yeah, I do. Thank you. Thank you, Brian. And this is actually for Brian Holloran. I'm going to ask him to help me fact check myself on my understanding of the NADAC. You read that and you're like, wow, this is pretty powerful stuff. This is a national average. But my understanding is that participation is voluntary and that many of the big three PBMs don't participate. So I don't want anybody, I want to make sure that I understand and don't walk away with a misunderstanding that this is actually a pretty representative national average cost. But what it really is something that's called a national average cost based upon those people that actually participate and contribute their data. And I think it's important for all of us to know who does and who does not contribute that data, so we understand how representative it may or may not be of a true national average. Am I correct on that?
You're correct on that, but not so much that the PBMs don't take part, but the large pharmacy chains. So even if a chain isn't owned or related to a PBM, they may still not take part in this survey. But you have that correct. Yeah.
All right. I just wanted you to help me. I thought I either read that or heard that somewhere. And you are much more subject matter expert than I will ever be. So I wanted to make sure I could at least validate my understanding. Thank you.
Yep. Sure.
Brian, one quick question on the national average drug acquisition cost pricing. How often is that published? I'm not, I don't. It's not.
From
like
what I understand, it's monthly on a monthly basis.
Okay.
Yep.
And if you were to hazard a guess, what percentage of market share actually contributes information to that?
I'd have to take that back. I don't know the most recent metric on that, but I can take a note and take that back.
Thank you. Any other questions, or can we let Michelle continue to get to the end here? We're burning up time.
I know. So our timeline here, we have gone through in detail in prior discussions as well, but the summary of it is this goes through when the RFP was released, when the proposals were due, the various meetings that I already discussed around the PRC, the interviews, etc., the materials being provided to the SCBC. This topic was not able to actually be covered on the 25th, but the information was provided to the SCBC. And then today's discussion is to focus on voting on the recommendation, which I will take you through shortly. The bottom here summarizes who was invited, who submitted proposals, and which vendors were finalists, which were 4C Health, CTI, Sagebrush, and Truveris. And then from a next step standpoint, today we are working to have the SEBC vote on the approval of the PRC recommendation. So I'll pull that up now as well. So a lot of the information in here in the background, I've pretty much gone through during the slide. So I'm going to try to skip over areas where I know that I've covered the information. And then from a timeline standpoint, the breakup here really goes through the specifics of the development of the RFP between August and October, the SEBC approving the scope of services in September, the release of the RFP in December. Starting in January was when the RFP process really kicked off with receiving bids in from the vendors. February through March, Willis Towers Watson and the SBO. Yes.
So just skip. I don't think we need to go through this line by line. So
You're fine. Okay.
Yes, please.
So I'm gonna, do you want me to even go through the scoring? I'm just conscious of
No,
time.
I think everybody was provided this information. I think we're just trying to get to a vote
Okay.
here on the recommendation.
No, that's fine.
Unless I'm reading the room wrong, but we good?
Yeah, no, I'm happy to just read through. So just to clarify for the full group, we normally summarize the background at the top here, but conscious of time, the main thing I have to do is read verbatim. So apologies for reading word for word, but read verbatim the PRC recommendation at the bottom here. So I'm going to focus on that. The PRC recommendation states that resolves that with respect to the request for proposal for medical and prescription insurance audit services, the Proposal Review Committee recommends to the State Employee Benefits Committee as follows: that the proposed real-time ongoing review services do not replace the retrospective audits. They would only possibly enhance and complement the retrospective audits. Claims Technology Incorporated, or CTI, provides the best value for the state of Delaware for retrospective medical and prescription audit services. It is recommended that the SEBC direct SBO to begin the negotiation of contract with CTI. The SBO include in each retrospective audit scope of services that CTI includes specific recommendations as to process and plan design improvements based upon findings and recommendations from each audit. That SBO works with CTI to include in the upcoming PBM and TPA RFPs and subsequent vendor contracts the necessary language to ensure that timely and efficient audits can be conducted. Such points in the PBM and TPA RFPs should include specific deadlines for the PBM TPA to work with the auditor in effectuating implementation of the awarded contracts and to provide information about claims needed by the auditor. Specific to real-time ongoing review services, the PRC has no recommendation for the award of a contract. The PRC recommends the SEBC continue to monitor the emerging capabilities of the real-time ongoing review services as they might relate to upcoming PBM and TPA RFPs and contracts, and as they might relate to the findings of the GHIP's retrospective audits. For the future, the PRC recommends the following: strengthen the audit rights in upcoming RFPs and contracts, consider the administrative and financial impacts to the state, including potential costs imposed by medical third-party administrators and PBMs for additional and ongoing data exchanges, as well as the implications of additional compensation to audit vendors conducting real-time reviews through retaining a percentage of monies recovered. So that is the PRC recommendation that we are putting forward today for the SEBC to vote on.
I just wanted to let everyone know that the state treasurer has joined the meeting.
Thank you. So I'd like to entertain a motion for.
Oh,
that-
yeah, this is Stephen. I'd like to make a motion to accept the recommendation of the PRC committee.
We have a motion.
Second.
We have a second. Any discussion on the motion? Seeing none, do we need to take a roll call or can we just say aye?
Carol's gonna do a roll call vote.
We'll take a roll call.
All right, I will start with the committee members that are in person. So Director Maxwell,
Yes.
Lieutenant Governor Gay.
Yes.
Karen Peterson.
Yes.
Bill Overly.
Yes.
All right, logged in virtually, Secretary Gordon.
Yes.
All right, Treasurer Davis,
Yes.
Commissioner Navarro,
Yes.
Director Constantino,
Yes.
State Deputy Court Administrator Ashley Tucker,
Yes.
Jeff Tashner.
Yes.
That's everybody, and it is approved.
There.
Karen Peterson.
If I may, just for a second, I'd like to recognize Mary Graham, who is here today. She was my designee on the PRC, and I just want to thank her for the many hours that she put into working on this. So thank you, Mary.
Thank you, and I must say it was very exciting. Actually, it was quite interesting. I'm very glad I got the opportunity.
And I'd like to acknowledge former Representative Nancy Wagner, who was my appointee, and I actually got a compliment from Pam Barr about her participation. So I really appreciate Nancy and Mary's involvement.
All right, well, Karen stole my thunder. I was gonna thank everybody, but definitely, I appreciate everybody taking, time out of their busy days to be a participant on this review committee. So I know it's time consuming, but, as chair of the SCBC, I want to thank everybody that participated in that. Thank you very much. So I think we're on to agenda item 5D, the vision benefit RFP, review of draft. Michelle, the floor is yours.
Thank you. So in front of us, we're going through the vision benefit request for proposal. Again, going through the context of today's discussion, the overview of the scope of services, the high-level RFP objectives, considerations to discuss for the next vision RFP scope of services, an outline of the RFP questionnaire, and next steps. For background to the SCBC today, we wanted to ensure there were some information here that allows you to understand what, where the vision benefit is today, as well as from an RFP standpoint, what has been completed so far, and then what will be needed moving forward. So at this point today, the state's vision benefit contract is with IMED. This will expire on June 30th of 2026. Throughout the first half of the year, the SBO was working together with Willis Towers Watson to draft the scope of services as well as the RFP. During that time, the SBO was able to survey employees for their feedback on this benefit, which we were able to take into consideration as we were drafting both the scope and the RFP that you were provided before today's discussion. During the April 25th SCBC meeting, we discussed the scope of services for this upcoming vision insurance RFP. The SCBC was able to provide their feedback and ask questions during that discussion. In preparation for today's discussion, we provided an updated vision RFP draft that is now with the SCBC for review and approval. In preparation, sorry, I already said that. Today's discussion will focus on an overview of that draft that was provided over to the SCBC in advance of this call to allow you to provide feedback and ask questions. And then any feedback that's considered could be incorporated into the RFP if needed. And then we will have the final version of the RFP to vote on for the June 2025 SCBC meeting. This slide goes through an overview of the scope of services. We did provide details of this during the last discussion, so I'm going to skim through this one because there are no major changes of the overview. I'm going to focus on the considerations we discussed for the next RFP. So when we met in April, we discussed matching the current vision plan design for the low option and the high option. We also discussed the ability for vendors to provide a modified low plan option to reflect slightly higher out-of-pocket costs but lower premiums, and then offered alongside that current high plan option design. The reason being is because of the survey results, we were trying to propose ideas that were meeting the needs of employees based on their feedback. During that discussion, the SCBC wanted to understand the utilization for progressive lenses as an opportunity for vendors to look at this to decrease premiums. We were able to get that information and provide it over to the SCBC in advance of this meeting as a follow-up from the last meeting. which is also in the appendix of this presentation. The SCBC also wanted to understand if discount programs, and one of the examples specifically we referred to was LASIK, could have any impact on premium rates. We were able to reach out to the current vendor, so IMED, and confirm that this was not something that would impact premiums, meaning removing discount programs, for example, or modifying them as an option. We talked through reserving the right to disqualify vendors should the proposed rates not be equivalent or better than what is currently in place for the FY26 vision insurance plan. We wanted to explore options to allow for higher frame and lens allowances for select providers while still maintaining a broad network of participating providers. Reviewing ways to improve communication. So again, some of the survey results reflected that employees weren't aware of discount programs or different things that were available to them. So just looking to find improved ways of communication for employees. The SCBC requested Willis Towers Watson and the SBO review the vision vendors that are available in the Delaware area to provide an extensive provider network, which we have researched for the SCBC and provided that information in advance of this discussion as well. And then just noting at the bottom, which I already mentioned as well, pretty much all of the follow-ups that I've touched on in this slide are available in the appendix and were emailed to the SCBC in advance of this discussion.
Michelle, can you pause 1 second? Steve has a question.
Sure.
Yes, this is on the provider network. I think I've mentioned this in the past. I might have missed that email. So you said you had sent something out on the extensive provider network?
So I did not, it was Stephanie, am I correct? It was you that provided an email to the SCBC on May 5th?
Yes, this is Stephanie Hardis. An email was provided to the committee, and actually the follow-ups are also in the appendices of this slide deck, which is publicly posted, which lists the vision benefit providers who have what is considered to be an extensive provider network.
Yeah, one of the things I've always had concerns with the benefit is that it's dominated by national kind of outlets, lens crafters, and one of the complaints I hear within, my fellow employees is that, their optometrist or their doctor doesn't accept IMED, they're out of network. Is there any way, as we go through this process, that we can kind of separate out national versus kind of independent practices or local practices?
Yeah, that's something we can look to. I mean, with one of the attachments that's in the RFP, we ask them to provide like the network disruption and where they have options available for employees and their dependents for vision. So we can also see, I'm happy to review that and see if there's any additional clarity we can put into the RFP as a takeaway from this meeting.
And I would suspect the RFP is also going to describe the out of network, cost to the employee. Is that something that is also going to be asked?
Yes.
Okay, thank you very much.
No problem.
Before we move off this slide, Michelle, just a quick question. Just that one bullet caught my attention. It says, reserve the right to disqualify vendor proposals should the proposed rates not be equivalent or better than the FY26 vision insurance plan rates. What if all our proposals come back and they're not equivalent or better than? What's our recourse there?
That's a very fair question. I think this is something, like, at least in my experience so far with working with the state on RFPs in the past when they didn't meet a minimum requirement, it's something that was brought forward to the PRC before making that decision. So I'm assuming it would take that same approach, meaning if all of the vendors came back in that way, that we would discuss that with them before disqualifying any vendors. But I would like to defer similarly to probably Stephanie at this point, or Faith, to add on if there would be a different approach there.
I think Faith has something to add. Thank you, Faith.
Thank you, Director Maxwell. Faith Renz. Yeah, the RFP is specifically written to allow the committee the discretion as to whether or not to disqualify vendors should that scenario that you described actually occur.
Okay.
And we were very careful in making sure that we left the door open not to come up with no qualified vendors in the RFP.
Thank you for the clarification.
Sure.
All right, Michelle, floor is yours.
Thank you. Okay, so moving to our next slide. So this is just a very high level overview of the RFP questionnaire. So the SCBC in advance of this meeting was provided the full RFP document, which I understand is very lengthy to review. But we wanted to focus on really the sections of the RFP itself, allow for any questions that you'd like to discuss today. But I'll just very quickly summarize what is on the screen today. So we have our bidder profile, which really gives the background on the vendor themselves, the account management, which allows the vendors to provide their team that would be supporting the state. The vision insurance administration and plan design that details out specifics and has questions that we understand the SCBC and the state are looking for specifically within this RFP. The network structure and access, owned retail location services, member services, online experience, integration with the state's data warehouse, customized offering, and then the three at the bottom are pretty standard across all of our RFPs with the state, referring them to the financials, meaning providing us their bids and performance guarantees, the technical standards and security requirements that are specified by the Delaware's Department of Technology and Information, and then miscellaneous, which has a lot of the legal requirements and data privacy invoicing requirements that are needed by the state. So all of this information, I'd say the last two specifically are very consistent across RFPs, where those above the last two bullets are expected to gather information specific to vision and any needs that we have discussed with the SCBC in those areas. I do want to pause here to just see, I know the SCBC was given time to review this in advance of the discussion, meaning the full RFP document and questionnaire, as well as the attachments that were included in that RFP, to open the floor to the SCBC if there are any questions about the draft RFP or what has been included.
And then question. You want to go to the next step? Yeah, perfect.
Yep. So next steps is that the SCBC, if there is any feedback after you've been able to fully review the vision insurance RFP, please provide that to the SBO by the end of day next Friday, June 6th. The SBO and Willis Towers Watson will work together to incorporate that feedback for the final version of the RFP that will be sent for approval for the June 27th SCBC meeting.
Can I just make one recommendation, Michelle? I know you mentioned, some of the committee members provided feedback. When we get to this last meeting, if there's additional feedback, if we could just bring up the RFP so we can show the members where we incorporated their feedback, I think that will help the process. And it can be just bullets and not the whole RFP, but just so people can check the box to make sure their comments were incorporated in the RFP. I think that will be helpful and move the process along.
Yeah, I'm happy to do that.
That sound fair to everybody? Excellent. I think
Great
we're
idea.
good. I think we can go on to the, this is the one, I'm gonna get Bill Oberly off of ice now, and we're gonna talk about.
If I might on the,
Okay, well, he wants to go backwards. Yeah, I can't figure this guy out.
on slide 11, and I'm just parroting what Paul sent in his email. He raised the issue on slide 11, why Anthem, Blue Frogs Blue Shield, and Humana are not included as potential bidders. And I have no background on that. I'm just parroting what Paul submitted.
I'm sorry, can you repeat that question? I didn't hear all of it. I heard.
I think Faith can address it. She's asked to address the question, so we'll let Faith answer the question.
Sure.
Thank you. Mr. Oberly, with regards to the vendors that are listed on slide 11, these are nationally known vendors in the vision plan administration space, but that is not to say that bidders in this process would be limited to those listed here.
Okay. Yeah, don't shoot the messenger. I'm just passing.
No, I appreciate that.
Passing along Paul's question, So it was,
So anyone with the ability to meet the requirements in the RFP is welcome to, submit a proposal
okay,
for consideration.
gotcha. Thank you. All right, Brian, you
All right.
can have that thing.
All right, we're gonna discuss the pharmacy benefit manager RFP now. I believe there's a presentation, Brian and Kristen's gonna walk us through, and then we kind of want to provide some feedback to the draft at that time. So we'll turn it over to Willis Towers Watson.
Thank you, appreciate it. So as you mentioned, myself, Brian Halloran, and Kristen McKee are going to walk through some of the elements of the PBM RFP. I understand it's already been circulated, so everyone will be doing their own review, but just wanted to highlight a couple items to bring up for discussion and any feedback. Starting with the minimum bid requirements. So the GSS template has standard language included on the screen there that the following information shall be provided in each proposal in the order listed below. Failure to respond to any request for information within this proposal may result in rejection of the proposal at the sole discretion of the state. We do have the opportunity there, if there's an appetite for it, to kind of tighten up that definition, basically to make it that failure to meet any of the minimum bid requirements will result in disqualification of the bid regardless of other merits, to try to kind of accomplish what we are as far as transparency and audit rights and things like that. We have a high number of minimum guarantees in the draft, high number of minimum bid requirements in the draft right now. I think there are about 29, but we can tighten that language up. Not sure if anyone has any thoughts on that or comments.
At this time, keep going, Brian.
Okay. So I'm going to go through, and again, I know we're kind of pressed for time, so just let me know if you want me to skip any of these sections, but some of the minimum bid requirements, we could either kind of keep the definitions the same, we could update the verbiage, or even move to the general questionnaire if we see fit. So just going to go through some of them, and if anyone has any concerns or additional comments, please chime in. So you see 4 columns here. On the far left, we have the proposed requirement for the 2025 RFP that's in the draft currently. Then we have the prior requirement from the 2020 RFP, if that applies. And then we have kind of a summary of what was changed, if anything, and then some considerations that we need to take into account. So the first one was around the state's ability to carve out specialty dispensing and management to an outside vendor if you choose to go in that direction. In the previous RFP, we had this stipulation in the minimum bid requirements, but also had that the state has the flexibility to do that with no impact to either the EGWIP or commercial pricing. Kind of the state of the marketplace now is that if you change any, if you were to carve out specialty administration, that there would always be an impact to that total pricing. So our thought was to remove that language at the end there, just to ensure that we weren't kind of precluding any PBMs from bidding if we include that in the min bid requirements. So that was kind of the first change there. Did anyone have any comments or thoughts there?
I do, Brian. So I'm not so sure it removes barriers for some of the smaller PBMs that we're really trying to attract here. I think this might be a barrier to some of the bigger players in the market space. So I'm not so sure I want to remove that requirement as proposed. I might want to keep the 2020. So can you convince me otherwise that this is really a barrier to the smaller PBMs or the newer ones that have kind of entered into the marketplace?
I think it would be more of a barrier to all of them, I would say, all PBMs, large and small. I definitely want to keep the flexibility in case you did want to carve out specialty if you found something that was more advantageous to the state. But just, I think if specialty is such a big chunk, it's over 50% of your total drug spend, that if you remove either the fulfillment or administration, most PBMs are going to want to go and revisit the contract and kind of impact the total deal. Kristen, not sure if you have any thoughts on this.
And I would say too, because it isn't a current state element, it's something we're looking for the flexibility in the future. We wouldn't have the details of exactly how that works, who's that carved out to. And for our concern would be with some of the smaller PBMs, if they don't have the connections to a particular carve-out specialty vendor, that they may be concerned with the administrative costs of building those connections. So, and they do tend to run on smaller margins. They do have an approach where their fee is just the ASO fee, and they don't have other elements other larger PBMs do. So they may, our concern was if they were concerned about that piece and impacting their business, if they said no to this, we didn't want to inadvertently have them removed from the process, given that there could be impacts.
Bill Oberly? Yeah, Bill Oberly. I'm actually, or I may be mixing apples and oranges here, but I go back to a conversation I had with Faith, I think about 2 months ago, about GLP-1s. And there were cheaper alternatives out there, some of which could be had through compounders. And, you know, I want to make sure moving forward we have the latitude to not be locked in with a contract with a PBM to a particular GLP-1. Now, again, this may or may not be what you're trying to get to, and perhaps you could straighten me out if I'm wrong.
Yeah, it's really the pricing piece. So we absolutely agree that you want to have that full flexibility to carve out specialty or any other categories, really run the plan as you see fit and as the market evolves. One other consideration is we're asking for other cost plus proposals as part of this. So we know a number of the other PBMs do a standard PMPM operation. So they would quote the business as a
acronym.
Oh, sure. Per member per month. So
I'm
it's
sorry.
almost like the fully insured fee. So they would quote, instead of all these different pricing guarantees, they would say, you know, we're going to quote, you know, $100 PMPM for the business. And that would include specialty. So that's where, without the extra detail here, if they were quoting a PMPM offer, they could say, well, wait, if I move specialty to somewhere else that I'm not managing, then I would impact that pricing guarantee, or maybe they pull out the specialty. So again, we're kind of thinking of literally, are there things, knowing that the market has changed a lot in the different pricing models, to not inadvertently preclude some of those.
So the language you've proffered for consideration would in fact allow us to do that?
Yes, absolutely.
Steve, question?
A quick question, which I think I know the answer to, but probably needs self-validation. Do any states actually carve out specialty to one PBM and have the rest done by another PBM?
Kristen, not sure if you know. I'd have to take that back. Not that I'm aware of, but it's something that we can try to find out.
Okay, thank you.
Yeah, sure. Okay, the next bid requirement here, if there are no further comments there, would be for the contractor to confirm that they're bidding on the commercial contract, that they have at least 200,000 members across their full book of business, providing similar commercial PBM services. So the thought here was, and if you notice, that's about 2 times your commercial membership. Previously in the 2020 RFP, we had a stipulation or min bid requirement that the taking on the state would not increase their mail service claims by more than 10%. We thought changing it to this 200,000 member threshold would allow for more of these smaller or emerging non-traditional PBMs to make it through the requirements rather than the 2020 requirement. So that was based on some feedback from the SCBC that we wanted to incorporate there. Any concerns or comments on that one? Like I said, I know everyone is doing their own reviews anyway, and I'll provide feedback, but I can move to the next one if not.
Karen Peterson has a question.
Yeah, just a quick question. What's magical about 200,000 when we don't have anywhere near that many people?
So you have 100,000 in your commercial membership. So we do at the same time is wanting to allow non-traditional or alternative PBMs into the bidding process. We do want to make sure that they have the capacity to support a plan like the state and that they're large enough, can understand the complexities.
Wouldn't 100,000 be sufficient? That they're the equivalent to what we have, and they would already be administering that. I mean, I don't want any artificial barriers along the way that would keep an otherwise qualified organization from bidding.
Yep. We can definitely consider that. We can go back and see if this number would preclude a number of the PBMs that maybe you're considering. But yeah, we can definitely consider lowering that number. So we can have further discussion on that unless anyone has any comments today.
I just think the larger the number, the fewer bidders qualify, and we might be losing out by doing that. Thank you.
Just to counter,
Mr. Overly, you have
counterpoint to that, I mean, 200,000 is really not a large book of business. And I guess what we're trying to do is get some of these smaller players in a cost plus environment, and that would afford us the opportunity to do that. Is that correct?
That this number would get many of those players involved.
Yeah.
It's not too high.
Yeah. Okay. Thank you.
Sure.
So Brian, I don't know if I'm going off script here, but I think minimum requirement number 13 says confirm your organization has experience managing pharmacy benefit services for at least 10 large and complex clients. Similar to the state, like I think we're going to eliminate a lot of people with that requirement as well. So I would look for an alternative to that or strike that section completely.
Okay. Yeah, we could look into maybe lowering the threshold, the number of clients, or maybe moving all of these. That's why we're talking about them. Definitely can update the language or move them to the general questionnaire, just to get an idea as to not preclude too many bidders. But we can definitely take that back. Okay, and I think we do get to that one on the next slide,
Yes.
but the next one on here, we have that the contractor will have a minimum of 5 consecutive years of experience in providing the scope of services for the commercial and EGWP plans. So that was, again, from the 2020 RFP, 5 years. Sorry, was there a question? Okay.
That was a call first.
Oh, okay, okay, sure. We were looking to keep that one the same. Most of the newer PBMs and emerging PBMs have been around for actually more than 5 years. Again, want to make sure that they do have the experience and knowledge to support a client like the state, but up for any additional comments or concerns while we're speaking.
Just, oh, I'm sorry. I didn't raise my hand. Does 3 versus 5 matter?
It's kind of subjective there. I think it depends on the PBM. I don't know that I'd feel confident if a PBM has been around for 3 years that they'd be able to jump in and support a client your size if they haven't in the past. But we could consider it. You
Yeah,
know,
I'm just, what are most contracts? Are they 5 years?
Most are 3. That,
Most are 3. That's one of
Yeah.
the reasons why I
That
said
was-
that.
yeah, I was thinking that too of it. I think 5 would help you see renewals of original
Yeah.
clients versus 3 years. We're still going to have kind of that early stage.
Hold on, Trini has, Commissioner, you had your hand up?
Yeah, I'll just say that 5-year mandate could be an issue. There are newer PBMs who are more transparent and actually market themselves as being more transparent. They may not be eligible. So changing it to 3 years might be, it may make more folks eligible.
And I think the committee to that point can use their discretion in evaluating that experience. So if we lower the years, we can look at their book of business and their, experience with regards to those folks. And so I'm open to flexibility there as well. Thank you, Commissioner.
You're welcome.
Karen
Thank you.
Peterson, I think Karen had a
I was
question.
just gonna say that pretty much the same thing, the PRC.
We agree.
The PRC can also evaluate that, but let more people in the pool, and then the PRC can also help.
Yeah,
Pretty much.
sounds good. Thank you. All right, keep going.
Okay, for our, I think you can move. Yep. Actually, back one. Michelle. Yep, there you go. All right, next one was around the EGWIP contract, ensuring that they support at least 60,000 members in their book of business. So this was changed from the 2020 RFP, where we asked for a minimum of 10 years experience in supporting EGWIP services. Again, trying not to rule out any alternative or emerging PBMs there. Not sure how you feel about that threshold. It is about 2 times the current EGWIP member enrollment. But we're, again, trying to allow some of the smaller PBMs and bidders to move forward in the process.
We keep going.
Okay. Next one is that the contractor has experience managing at least, this is the one we just talked about, 10 and large complex clients like the state. So we're going to take that back and possibly look at either lowering the number of clients or the lives threshold there. So that was the one you brought up.
Yeah, we want to eliminate poison pills. So
Yeah.
we're trying to knock them down. So if we knock one down, we don't want another one that we have to swallow later. So if we could just take a close look at that.
Sure. Okay, next one was around the account team. So the account executive and account manager having a minimum of 5 years experience and working within the organization for at least 3 years. This was changed from a prior RFP where we were asking for 10 years of experience in the healthcare industry and 5 years in their current role. Again, to allow for those newer PBMs that are going to have shorter tenured employees to move forward in the process, but kind of softened that one. Not sure if anyone has any feedback or thoughts on that.
Seeing none, keep going.
Okay. All right, next slide. Okay. Next is around, and we touched on this a little before, but is around rebate aggregators. So the contractor represents that it owns its own rebate contracts directly with the pharma manufacturing companies and does not use a rebate aggregator, or if they do use a rebate aggregator, that the rebate contracts are fully auditable with up to 20 pharmaceutical manufacturers. So rebate aggregators are these organizations that kind of pull their purchasing power and handle a lot of the rebate administrative duties. the big three PBMs all own a rebate aggregators. Some, but not all other PBMs are a part of a rebate aggregator, or they are part of a group purchasing organization, which is very similar. So the idea here is, of course, we always want the most auditing rights, as we kind of touched on before. So you'll gain that with having direct view of the contracts between the PBM and the pharma manufacturer. But some of the maybe smaller PBMs that are just a part of the rebate aggregator, that are a member of them, may not have the rights to the actual contracts with pharma. So we may have to kind of update the definition there of rebate contracts to specify whether it's the contract between pharma and the GPO or pharma and the PBM. So something that we might have to take a look at there. Again, trying not to preclude any of the smaller or emerging PBMs from moving forward in the RFP. Kristen, not sure if you want to add anything there.
So I think it's a balance of that transparency and also keeping the door open for all PBMs in the marketplace. And because of the volume in the market, many have to add on to other aggregators or utilize some of these larger organizations for the rebates. And and so it's that pharmaceutical manufacturer contract that, for transparency, would be ideal to be able to audit and have an auditor see those actual contracts with pharma. Because of the aggregator relationship, many smaller PBMs may only be able to offer audit rates at this time to what they have agreed to with the aggregator, but the aggregator won't let them further allow access to those pharma contracts.
Thanks, Kristen. Moving to the next one, was around rebate guarantee modifications.
Brian, one
second.
second. Bill Overly. Brian, I wanted to go back. You said you're contemplating updating the rebate contract definition.
Yes.
Okay. All right.
Yeah. Yep. So on the next iteration, we can propose some language around that.
And I think there it's really committee consideration of importance of seeing those, auditing the actual manufacturer contracts or keeping that requirement more open to what the PBM is able to allow. And again, it's more from the smaller PBMs that are subcontracting with other organizations to get the rebates.
The next bid requirement speaks to not allowing the rebate guarantees to be impacted unless there was a formulary impact that would result in 10% or greater loss in total rebates. So this was from the 2020 RFP. Our recommendation was to move this one to the questionnaire. As some of the pricing models that we're looking at, like the cost plus models, the rebate guarantees are less relevant in those models. So don't want that, again, being a barrier. So keep it included, but maybe move it from the minimum bid guarantees into the general questionnaire there. Any concerns right now with that one?
I do have one on this one, Brian. I believe there exists an NDC 11 rebate reporting. And does that allow for even greater transparency than NDC 9?
Yep. So an NDC 11 would be a more granular view. So those last two digits would signify the package size. So NDC 9 gives you the manufacturer, the medication name, the drug strength, and then those last two digits in NDC that would make it NDC 11 would also signify the package size. So kind of we're seeing in the marketplace some NDC 9 reporting being available. Again, didn't want to preclude the PBMs that have that subcontract with a rebate aggregator from moving forward in a process if we were making that too stringent, but definitely open a conversation here. And again, could move from mid-bid to the questionnaire or update the language there, but it was a concern that we might preclude some smaller PBMs.
I don't, obviously that's not our intent here, but we do have a competing interest here with regards to transparency.
Yeah.
And so I think, I don't want to speak for all committee members, but I know transparency is a pretty high priority. And so I would like to gain maybe a little bit better understanding as what we would be giving up between the two, that last digit, 9 and 11. So if you could just provide some feedback to us, that would be fantastic. Just in my research, I know a state hired a firm to kind of work on their RFP to provide the most transparency. And in that RFP, it made a requirement of having NDC 11 on there. So, I look forward to hearing back from you.
Okay. We could take that back.
Mhm. And an option too could be if we have true minimum requirements to have NDC not at a very minimum NDC 9 reporting at the front and continue to push for NDC 11 in the questionnaire. I do know some of the smaller PBMs do currently have the NDC 9 rebate reporting ability, but they don't have NDC 11. So again, that was more of the thought process in recommending the 9 to keep it open as possible in the minimum requirements.
Thank you.
Okay. If no further questions, I think we can go to the next slide. And this is just an general overview of the RFP process. So we're going to release the full PBM RFP with the minimum bid requirements and the full questionnaire at the same time. The min bid requirements will be reviewed first, and then any bidders not meeting the minimum bid requirements will not move forward in the process. The vendors that do move forward will be evaluated and scored based on their full proposal. And you see kind of the general timeline there with the RFP being released on July 15th and then our recommendation on Friday, December 12th. So just wanted to give a general overview there of what we're looking at for the RFP process.
So I know we had talked about this at a previous meeting about the general information and the length of the contract. The draft currently has a 3-year contract with 2 1-year extensions. And I believe there was kind of appetite to kind of shorten the contract to 2 years and then have 3 1-year extensions to it. So I'd like to see where the committee stands with regards to that as far as
That would be my preference. To have a shorter term on the front end with possibly 3 1-year extensions. I think it would give us it wouldn't lock us in for beyond that 2-year period, and we could adjust accordingly if it's not working out.
So that was Bill Overly. Any other comments?
I would support it as well.
We heard at the
Yeah.
last was that WTW expects that it would take 2 years to get up and running for a reverse auction. And so that 2-year would give them time to do that so that we could possibly convert to reverse auction the subsequent contracts.
That's assuming, like, we could be happy in 2 years. I'm not trying to say we're definitely changing, but I'm just saying it would give us a chance to evaluate
We don't want to get locked in.
how our transparency is working out as far as a goal of this particular process. And we always had the opportunity to go out 5 years, but that initial period would be two years. So I just wanted, I had heard it. I wanted to make sure it was highlighted because we do have to try to get this across the finish line.
Yeah.
Anybody else have a question? Okay, great. I see a thumbs up from Jeff Thatcher. He's not going to interrupt us, but I see a thumbs up.
I just have
Bill Overly?
one quick question. I mean, in the proposal draft proposal we got, I mean, it's like 95% boilerplate, I would assume. And I guess what we kind of went through today is almost an executive summary of what would be included. And I guess maybe I'm the only one on the SCDC, but I guess moving forward, taking a boilerplate out and dealing with, you know, the cost plus, making sure we have the smaller PBMs, ability to participate in the process. We couldn't boil that down rather than have to go through 265 some pages. I mean, is that an unreasonable request? Although there may be, well, go ahead, Mel. Stephanie?
Sure, thank you, Stephanie Harness. I just want to make the committee aware that is based on changes to Delaware code.
Right.
It is required now by Delaware code that the SCDC approve the full RFP, which does, it does include that full document. Unfortunately, and I know it's a lot to work through.
I guess my question, is there a way to separate the boilerplate out
Yeah.
from the
absolutely.
guts?
He's looking for the cliff notes, I think
Yeah.
that's what he's saying.
Yeah.
Did they have cliff notes back here?
Yeah, sure did. It was done on a chalkboard though.
Absolutely, we could definitely send two versions, the version that's the full RFP for approval, as well as a subsequent version that's what is editable by the committee.
I appreciate that. Thank you.
Steve, you have your hand up?
Yeah, is the suggestion 2 years? I'm sorry, I missed the very beginning of that.
The suggestion was 2 years being the initial term of the contract, which is different than the draft. Currently,
Right.
the current draft has 3 years. I was throwing it out there because I had heard
Yeah.
from committee members in previous discussions that 2 years would be preferable with 3 one-year extensions as opposed to 3 and then 2.
Yeah, my only issue with that is, it's coming from you, this may seem counterintuitive, it's coming from the fact that I'm very much interested in seeing these boutique and smaller PBMs in this, and would they say that 2 years is just too much of a risk for them rather than 3? We know the biggies are so well financed that could probably do it in 1 year and they do it, but I'm just wondering if that in a really strange way might be an obstacle for something that some PBM that's smaller. Just something to consider. Maybe we have to do some reaching out and check that, but I'm just wondering if it's just like usually the smaller you are, you want a little more time in a contract. So just something to consider.
Does anybody, Brian, do you have more?
We, not in this section. If we want to move to the questionnaire section, I can get through this quickly. Unless you want to skip, you tell me.
They're beyond our allotted time right now. and
Okay,
we have
okay.
a few- No, don't stop, but what would you like to do?
Right.
Well, we did revise the agenda that say 1 to 3, but. Yeah. What would you want them to continue on with this?
No, that's fine. I'm good.
Okay. All right, I think we're good, Brian, with regards to that. What do we have? Health data warehouse RFP, scope of work?
Stephanie Harness, if possible, I know there was interest in discussing how the Senate Joint Resolution could be incorporated in the PBM RFP.
Yes.
So to the extent if there's not enough time to discuss today, we would very much request that feedback be sent via email to ensure that the next version of the RFP being sent has that committee member feedback. So to the extent if there's any discussion today, if not, that could follow up via email, and we can incorporate that.
So I want to ask the committee members a very important question. I believe this PBM is a very important, request for proposal that we're working on. And so we have very limited time. The next time we're going to meet is we're really looking to approve this document. And so June's a busy time for me, but I will put it out to the committee if we wanted to have an additional meeting to regather to talk about the PBM RFP so we can
Absolutely.
put our heads together and try to finalize it during that meeting. And in that meantime, between us meeting again, if Willis Towers Watson could provide a document to us as to what boxes we're checking on the Senate Joint Resolution, and we could get that in advance of the meeting. That way we could kind of feel like we're in a better place. And so I'm throwing it out there that I want to get my friends together for an additional meeting in June. I just want to see who is in favor of that.
I think it's a great idea.
Is anybody against that idea? Okay, seems like we have consensus, so we'll schedule that, and that kind of takes a little bit of pressure of not going through that questionnaire right now, but we'll try to get everybody on the calendar. And Willis Towers Watson has the charge of evaluating Senate Joint Resolution 7 and how the RFP is addressing that. Good?
We'll take that back and get that
Thank you.
together. Yep. Mhm.
We're gonna get a D, 5D.
All right. Hi, everybody. I'm Dave Orndorff, and I'm from Willis Towers Watson, and I support the state of Delaware. I'm a director in our health analytics practice. So I know we're running behind, so I'll move rapidly. But if anyone has questions, please stop me. So we'll start off today with the background and the context for today's discussion. The states engaged WTW to support a procurement for health data warehouse services for the group health insurance plans, medical, health management, and pharmacy programs. The incumbent vendor, Meritive, currently maintains a monthly claims data feed from Highmark, Aetna, Lantern, and the PBM CVS Caremark. They also take in data from the state's medical carriers from an eligibility perspective. So that's Highmark and Aetna. And it's the eligibility that ties all the data sources together and makes the whole data warehouse work. In addition, Meritive currently offers a decision support tool called My Benefits Mentor, which provides recommendations based on employees' own historical claims data, which helps them pick the health plan for the coming year that will best suit them based on their use of healthcare services in the past. The state's contract with Meritive expires on June 30th of 2026. So with that as background, we're going through this we're starting an RFP. The SCBC will be issuing it with the contract start date effective of July 1st, 2026. What we're going to do for the next couple slides is provide an overview on the proposed scope of services for the next RFP, gather any feedback from you, or set the stage for feedback from the committee members that we're going to incorporate into the full RFP as it's developed. On the next slide, we're going to kind of go over the considerations that we use when selecting a data warehouse. I won't go through all of them, but we've bucketed them in themes, right? So clearly, vendor experience. We want vendors who are who can handle clients like the state in terms of their size and similar structure. We also evaluate the account management structure of the data warehouse vendor, right? So how the organizations put together, their experience of account management, the data scientists and data architects that they have on staff, the technical support, and the clinical and analytical support staff that's there, that will be there to serve the state. And then also we'll evaluate their capabilities in terms of client service, both through the implementation process, should you change vendors, how quickly they can build out the data warehouse, because if we change vendors, time does move very quickly, but also the ongoing analytics support that the state currently enjoys today. We won't want to drop off on it. And the next thing we evaluate is the data architecture, data quality, and data integrity, and we'll talk about that a little bit more. Overall, first of all, system security, right? To make sure that the data is held securely, both at rest and in transit. confidentiality and privacy of the people whose data is maintained within the data warehouse. The intake data standards, so including standard feeds like medical, pharmacy eligibility, but also non-standard feeds. So things potentially like employee assistance program or clinical lab data. We want to understand all the vendors' capabilities for a variety of disparate data sources. We want to understand their methodologies, specifically the availability of benchmarks, which is very important to the state. We want to make sure that they have a very robust benchmarking database that includes commercial and state clients. And we want to understand their technology platform to make sure it's current with today's standards, to make sure that it's fast enough and robust enough to serve the state and the vast array of data that's going to be going into the data warehouse. Reporting and user experience. So the design of the data itself, the output of the reports. Today and what's on the roadmap going forward, we're going to ask about their use of AI today and going forward from an analytic perspective. We evaluate user experience, right? Is it intuitive? Does the reporting come out of it accessible, meaningful, and insightful, both from a standard dashboard and ad hoc request and deep dive analytics. And then we want to be sure that whoever we select has the sophistication to complete propensity match cohort analytics, predictive analytics, and then a suite of both clinical and financial reports, both today and going forward. And just as important, we want to pick a partner that's flexible from a contracting perspective and a pricing perspective. We want them to be very competitive. They need to be staffed. Today, we've got an on-site resource, a dedicated resource that produces regular reports, but also answers ad hoc questions. And we want to ensure the right levels of expertise in data management and data operations, right? So the data warehouse is only as good as the data that's going into it. And then finally, we want to set expectations around partnership going forward and at the level of commitment that's required to serve a client like the state. Underneath all that, it all doesn't work unless there's robust data security protocols in place and that they meet the state's minimum data security requirements. So those are the evaluation criteria that typically we use through the RFP process through lots of questions. So with regard to the scope itself, we bulleted some considerations that we want to incorporate into this coming scope of services. The state has expressed interest in investigating additional clinical information such as lab data and potentially care management data. That's going to help us better understand which of the state programs are working effectively and where we may need to course correct or understand where we're doing a good job. Additionally, there's been a lot of focus, understandably, on pharmacy. We're going to ask for the ability to ingest line item rebate data, and we're going to ask the capabilities around the data warehouse vendors of their abilities to match that at the pharmacy claim line level. That will help us really better understand the impact of rebates and help us reconcile them from an audit perspective as well. We're gonna ask the vendors to review and understand the type of files that are ingested today, but also what's coming in the potentially in the future. So non-standard data sources, including, as I mentioned, EAP, vision, dental, all of which helps us get a holistic view of the members that are within the data warehouse. Today, we've got a very robust account management services through the incumbent vendor. The state enjoys quick turnaround times on ad hoc analytics. They enjoy very accurate and consistent reporting. And the state is going to set those expectations within the RFP itself to ensure that the vendors understand what is going to be expected of them going forward. Currently, the incumbent vendor maintains 4 years of historical data. If it turns out a new vendor is selected, generally the carriers, so Aetna and Highmark, usually maintain 2 years of calendar year data plus the current year. So we're going to set the expectations that the vendors will need to work with the state's carriers to get at least 4 years of historic data going forward and negotiate any costs that may incur as a result of that request. All right. Any questions so far?
I think Steve has a question.
Yep.
Yep.
And you might have just, well, maybe not. One of the questions I have is what, and this may be more of a research issue rather than a data analytics on SCBC claims issue. So if I were to ask, you know, we have now a few years of GLP-1s being administered for weight loss. And there have been some early research studies saying that it has some benefits in the long run. I don't know if there's enough data there, but if I were to ask you for a group of SCBC employees in the aggregate that have taken GLP-1s for weight loss, have we seen things like diabetes or obesity drop? Is that something that is potentially something that the data warehouse could deal with?
Yes. Well, and I'll expand on that, right? So when what if I were going to do that analysis, I'd create a cohort of people, right, who've taken the GLP-1 medication or had a script for one, right? Because that's we know if they get a script, we don't know if they've taken them, but we'll surmise that they've taken them through the data. And then what we could do is track over time whether or not, you know, they continue to get claims for a diagnosis of diabetes over time, right? And then you could track their health risk through a health risk score, which is a function of their diagnoses and their demographics.
Yeah, what I'm more
right?
concerned about is I understand how you're answering it, but would the vendors have the capability to, could we mandate that kind of analysis in general?
Yes.
Okay.
Yes. The answer is yes, we could do that, and they could answer how they would. You know, that's a question that we could ask them as part of the RFP. One of the things I like to do is ask use cases, right? So how would you solve this problem, right? So yes, we can incorporate that if that's the question.
I know we're short for time, so I just wanted to quickly ask that.
Yeah,
appreciate that.
I appreciate the question, but we're kind of getting too far into the weeds. So if we could continue on, please.
Yeah. Okay. Yeah, I think we're covered on this. Slide. So these are the objectives that we're going to lay out for the respondents, right? That they're going to offer state-of-the-art end-to-end analytics solution that interfaces with all of the partners at the state. They're going to help us support the healthcare consumerism initiatives of the state. We're going to reiterate the excellent account management services that support the state's initiatives, both day-to-day and long-term. They will need to provide a dedicated analytics resource to provide support on a regularly scheduled and ad hoc basis. We need to understand their standard management reporting and what their turnaround times are and how often we'll get them. And they've got to be competitive financially, and we need some guarantees around their implementation. In terms of support in how much effort will be required from the state as part of implementation should a new vendor be selected. And then we'll need to understand their data security protocols and ensure that they meet the state minimum requirements. Same with the state contracting requirements. At this point, we could look at, I'm sorry, go ahead.
Just a quick question, like since the last time we went out for RFP on there, has there been any new proposed objectives added to this list? Because I'm just thinking that with the evolution of AI, whether there's new things that we could get out of this service that might have not been available previously.
Yeah, we do incorporate questions around, specifically around AI within the RFP. We did add not only, there was actually an intelligence question before, but we've reiterated and I think added a line about what's on their roadmap, specifically in the context of AI over the next 24 months. So what they're doing today and what's on the roadmap within the next 2 years.
So
All right.
it looks. You have a question? Oh. Okay. It looks like we are scheduled to vote on this for the July 22nd, so we'll have another opportunity to obviously review the RFP and then approve it on July 29th. So, thank you so much. Appreciate it.
Stephanie Hardis, just want to note a comment from Paul Bomback as well, who has requested to know which firms were invited last time this went out to bid, who had submitted bids, and who is anticipated to be invited for this RFP. So we'll ensure that that is included for the June meeting. Thank you.
All right, I think we're up to the financials. So Brian, can you bring us home rather quickly and hit the high points of the financials?
I certainly can. Financials in 60 seconds or less. So results were relatively benign to what we saw in March. If you take a look, screen this down. Premium contributions were about $800,000 lower than expected. It's basically a continuation of what we've seen on the non-payroll group side, so it's nothing new there. Just a continuation of what we've seen throughout the year. Other revenues were about $300,000 less than expected due to a lower than expected direct subsidy. So you can see the direct subsidies we're expecting about $3.5 million a month. April was 3.1, but March was a lot higher. So looks like it was just a timing thing on the direct subsidy side. Claims, while it shows $16 million worse than expected, that was primarily due to the fact that we were anticipating that 4 invoices on the Highmark side would be processed in April and 5 would be processed in May. And it turned out that the 5th one slipped into April. So you can see pretty much across all the Highmark columns, a lot more in actuals in April, but then a readjustment to have May dip back down against plan, where we'll have four weeks in May against an expected 5. On the expense side, expenses were about $5.4 million higher than budgeted, pretty much solely due to the fact that there was a performance guarantee payment due to Highmark that was paid in the month of April. You can see in the notes $5.65 million. Won't go through it, but there's some details in the appendix about the Highmark performance guarantee program. From a GLP-1 standpoint, we can see that claims still continue to rise in the month of April, but have dipped down from the big jump up in March. Actually, through 10 months of the year, we're pretty darn close to spot on to where we thought FY25 was going to come in. Obviously, albeit at an alarming more than $52 million standpoint on the commercial side for weight loss. And then in total for the year, we're expecting all things added in about $4.4 million better than budget, being premium contributions, revenues, less claims and expenses, which you can see with the phasing out to the month. We were expecting to end the year at about $66 million, and now we're at about $70 million for the year. And then from a long-term projection standpoint, this is updated to reflect the fact that the 4.2% approved for FY26 based on a 3-year smoothing would continue to be at 4.2 and 4.2 for the next 2 years, which obviously needs new votes each year. And that would ultimately lead to a much bigger, almost 16% increase for FY29, all of the things being equal. And then the last comment is just this long-term projection is slightly different from the one that's in your deck. So we will make sure we send out a revised version after the meeting today. And I think Stephanie said it'll get posted on Monday. So blitz through the financials. Please let me know if anybody has any specific questions.
Bill Oberly, and again, I'm sorry. The last page, as it relates to the Highmark Shared Savings.
Yep.
Program. Looks like, from my perspective, I made a note here, it looks like we ended up taking it in the neck in terms of that agreement.
I guess the other way it could be looked at is that claims came in better. I mean, yeah, claims came in better than how the guarantee was set. I know the performance guarantee language is one of the topics that are being reviewed for the upcoming RFPs, but I think the way to look at it is there was a trend or a total cost of care guarantee that was set based on the SCBC's approved criteria for that guarantee, and the performance of the GHIP was in excess or better than that threshold, without digging into necessarily all of the reasons as to why the GHIP performed better.
Unless I misunderstand this whole process, it looks like we owed at the end of the year Highmark $6 million. Is that correct?
That's right, Bill. And that $6 million was a percentage of the amount that the GHIP performed better than the guarantee.
And this was something that was enacted in 22.
It was enacted for FY23 and FY24 as a 2-year period, obviously measured with delays because it was based on claim runouts, I think through August. And it was a 2-year period. So there isn't one in place for FY25 performance.
Yeah. Am I comfortable in assuming there's not going to be a recommendation to enter into this again?
That I'm not sure. You know, the performance guarantee criteria is something that we continually want to review and make sure that they are set reasonable and appropriate to market and expectations. But that's something that would be determined during the RFP process in terms of what is requested of the vendors being awarded the business.
We'll deal with that with the TPA. So,
And we could assign a subcommittee to look at that as well.
Karen can share
Okay. Can we get a second?
Just slip my throat.
it. Thank you.
Any other
Anything else,
questions?
Brian?
Not from my end. I know, Stephanie, in light of time, I think we were going to potentially table the presentation of the quarterly financials. Is that something you want to do, or do you want Kant to run through them sort of at the same pace I ran through?
Pleasure to committee. You want to go through the quarterly or?
Well, I mean, I don't know. I did review them. I mean, if necessary, I guess at the next meeting, mid.
Yeah, we could do it with that. Yep.
Sure.
Awesome. Okay,
Is
so
everybody good with that?
I'll stop sharing and then turn it back over to, I don't know if it's Michelle or if it's you, Stephanie, to go through. I think it's agenda item 7.
I have it up, Stephanie. I can just put that there for you.
Great, thank you. And this will be brief. So good afternoon, committee members, Stephanie Harness. As requested by the committee earlier this year, an amendment to the resolution of the State Employee Benefits Committee to establish the financial and health policy and planning subcommittees was distributed to the committee last week, as well as posted publicly for review. This resolution was originally created in 2018 by the SEBC to allow the formation of the Financial and Health Policy and Planning Subcommittee. And the goals were primarily to assist in the work of the committee. This amendment that is before you and was distributed earlier, dated May 30th of 2025 today, makes technical corrections to the resolution regarding the membership of the subcommittees. This is in accordance with recent changes to Delaware Code effective January 1st, 2025, specifically related to committee membership, ability to appoint designees, as well as stating that the chairperson of the Financial or Health Policy and Planning Subcommittee must be a voting member of the SEBC. And this was all to ensure compliance with Delaware Code, again, as effective January 1st of this year. And this amendment was drafted with committee member feedback that was received over the past few months, as well as was reviewed by the SEBC's Deputy Attorney General, Michelle Whelan, with DOJ. Do any committee members have questions on the amended resolution or any additional feedback that they would like to provide?
Karen Peterson.
Chair, yeah, two things. On page 2, at the very bottom, it says the 2 Delaware retiree members, the SEBC, appointed by the Speaker of the House, President, and take that back. Up the page, to the bottom of F, it says that we may each nominate in writing one retiree, which will require the approval by the Speaker of the House and the President pro tem of the Senate. I should probably say or. I was appointed by Senator Sokola. I wouldn't have to ask the Speaker of the House to approve my nominee. So if we could change, and that's in 2 places. Under each committee, Stephanie, it appears. And the other thing, and this is something that has bothered me for a couple of years, and that is the fact that we call these subcommittees when they're not. A subcommittee is a subset of a committee. There are committee members on these committees. It just says the members of the committee shall be appointed by the chair and vice chair or persons nominated by the SEBC. So SEBC members aren't even on the subcommittee. And if you look at the last sentence of this document, it says these are advisory committees. So I'm wondering if we should change it to call them what they are, which is advisory committees. They don't consist of any SEBC members, let alone a subset of those members.
Well, they have to be chaired by an SCBC member. Correct.
That is correct, and I do want to note that all committee members can serve on the subcommittees for the Financial and Health Policy and Planning Subcommittee.
Yeah, except the resolution says nothing about who serves. Other than, it doesn't say SEBC can serve. It just says the members will be whatever names we give to the chair and co-chair. So maybe that should be clarified, but a true committee, if you look at Robert's rules, if you look at all this, it says it's a committee composed of some members of the larger committee. And that's not what either of these are. Now, the RHBAS is different because the legislature appointed those members. They're not, they're not names that I give to Brian to appoint. So, I mean, just something to consider because these are not actually subcommittees, they're advisory committees. So just throw that out there. I'm probably the only one who thinks we should do that, but no.
I appreciate you sharing those comments. Do we want to?
And I'm sorry, it's including Robert's rules actually says the subcommittee must consist of members of the committee. So unless we follow Robert's rule, but in the legislature we follow Mason's rules, but I guess we follow Robert's.
To clarify, are there members who are not appointed, who are not committee members and who are not appointed or designated by members?
So every committee member has a spot that they can either serve themselves or appoint someone to serve the Financial and Health Policy and Planning Subcommittee. There are no members to either the Financial or Health Policy and Planning Subcommittee outside of those under the SEBC. So there's no additional members outside of what the committee would appoint, basically as a designee of themselves if they choose to do so. And again, the full committee could choose to serve on those subcommittees if they wish.
So that does that change the consideration?
It's just, well, in that case, Stephanie, we should somewhere in here say that these these are committees of the whole. And they can appoint designees. But nowhere in this document does it say who makes up the subcommittee. Except when you get to the bottom here where it says the members shall be appointed by the chair and vice chair. And of course, they don't have to be members of the committee. They could be, my cousin. It doesn't, as long as my cousin's a retiree.
Yeah.
So I mean, it either needs to be clarified that this subcommittees are committees of the whole, and they can designate designees.
Lieutenant Governor.
My only other clarifying question would be for our attorney to understand whether whether rules of the committee outside of this resolution so establish those mechanisms, and that the resolution just names the subcommittees themselves. But we could always consider that, I don't know, for a future meeting. Seems like we've been operating outside of the law for 5 months already. Is that?
Yeah,
Not with conflict, but just by not mistake. So we could do this at another meeting as well.
Well, so Bill and I don't have any representatives on your subcommittee because we haven't amended the rules. So
The action hasn't met either.
Yeah, they are not active.
Understood. Thank you, Ms. Harris.
I had, right,
Bill Oberly?
I'm sorry, are you done with that?
I can, yes, thank you. We, in the interest of time.
Yeah, I had, I guess one question about the mechanics. Parents' appointment requires approval by President Pro Tem, mine by the Speaker of the House. What are the mechanics? Do I come to you with my recommendations and then that's conveyed to the Speaker of the House? Or, I mean, how are we supposed to proceed? I mean, the Speaker of the House, like you, has a lot on her plate, and, things get lost, particularly, at this level. So I just don't know how to proceed at this point.
In the interest of time, there's a lot of questions around this resolution, so I would like to table it and we can do some further research. And we want to get this right. We want everybody to feel comfortable with it. So let us take it back and get some advice from our legal counsel and some of the concerns that were raised today. Is that fair?
Yeah, could I?
You got
actually-
2 more things.
I'm sorry.
Who appointed you again? I gotta talk. Totally joking, 100%.
Go yell at the Speaker.
Yeah.
Anyway, currently, the way this is structured, a member of the subcommittee can appoint someone to attend in their place, which has historically bothered me. The institutional memory is extremely important. And I think continuity on these subcommittees, which basically, having served for 3.5, 4 years, I mean, we get down into the weeds on all the issues before it's referred to the SCBC for consideration. So I have a concern about an appointee sending someone in their stead, which occurs more often than not, as opposed to that person continually participating in the process. So that was one issue. The other issue is, and I think it's been resolved, it's been a bug of mine for years, that I've always advocated that there should be a roll call vote for anything proper recommended to the SCBC for adoption. And I think there's language in there that does require that. It doesn't overtly state it, but I think it said it requires a majority of quorum, which would contemplate a vote. So, they were the 3 points I wanted to mention, so I apologize.
I think we've been taking roll call on anything that we're approving, so I
No, I meant at the subcommittee level.
at the subcommittee.
No, it's not.
Okay,
been-
okay.
I can recall maybe once or twice we took a roll call vote, but other than that, it's been the defense of the
Gotcha.
subcommittee.
Okay,
So,
point noted. Mr. Tashner, you have your hand up?
Yeah, and I know you're trying to wrap up, but I will do this quickly, providing a little history and context so people can think about this. And I'm gonna say it publicly. It pains me that Bill Oberly and Karen Peterson are there, and I'm the one providing the history and context. So it's a personal comment. I'm making on myself. There was a time prior to the addition of the labor representative member on the SCBC when the code actually included something known as the SEBAC. It was the State Employee Benefits Advisory Committee, and there were a number of groups. We were one of them that put people on that committee. When the labor representative, the first one, was added back in, I believe, 2016, that same bill eliminated the advisory committee because there was a lot of frustration over whether or not they had the ability to advance things to the actual SCBC, whether the SCBC would even consider them or not. And people can go back and look at it. What happened back around 2018 is a lot of what you all are experiencing now. We would come into the meetings, there would be a ton of stuff to get done. Meetings would run late. So I was actually the one that recommended at a time when Mike Jackson was the chair that maybe what we needed to do was something like DFAC did, where we had working meetings at the SCBC in the morning, and then we had our meeting in the afternoon so that we could spend more time on these important matters and get the work done. The resolution that was drafted did something a little different by creating the two advisory committees or the subcommittees, Finance, Health, and Policy. And that's how they came about, to try to give people an opportunity, like Bill said, to dig in a little deeper. To tell you, we made it better than it was without them. We probably didn't perfect it. We now have a advisory committee on retiree that's in statute, which these two are not. But there is some history behind what used to exist and why these subcommittees are there. And I don't want us to lose that, because the idea was that it would be an opportunity for us. And I sat in, Faithful Remember, when they first came about. I actually sat in on a lot of the advisory committee meetings along with my designee. I don't know that a lot of other SCBC members did that, but there's a history and a reason for the committees, and it's to be able to make us better at handling what we all know is a pretty daunting scope of responsibility when you're looking at not just the medical side and the prescription drug, but all the other benefits that are under our purview. So I just wanted to put that out before you pause and people come back so they have something to think about historically.
Appreciate that. Thank you. All right, so I think we're gonna table that item, which then leads us to public comment.
Can I just make one request?
Oh, Lieutenant Governor, I'd like to make a request.
I do apologize. Could we set a date by which we can have edits to this in writing so that we don't get bumped up against? I think I'm a visual learner, and I would appreciate just having like written just to consider if people have any.
Sure. Stephanie Hardis, absolutely. It sounds like there's interest in the committee of, again, this is a resolution developed by the committee, right? So it sounds there may be interest in maybe developing something different, which I think could go with the work plan that the SCBC is working through as well. If the interest of the committee is to review these revisions at the June meeting, we can happily send that to you at least a week in advance of that meeting. However, again, if there's, I think we'll need to connect with the DOJ a bit to discuss some of the changes.
I don't want to commit to the next meeting because like the focus of the next meeting is really on the PBM.
Understood.
And so like, I don't want to get distracted
Yep.
from that task. So if we could kind of put it in the second June meeting, I would feel more comfortable at that point in time.
Thank you.
When would you need our written comments to get them out?
As soon as possible, I would say within the next week, by end of next week, June 6th.
Do I need to follow up, or did you take note of my comments?
We have the recording.
We have notes. So if you have additional comments, please feel free to send those as well.
Thank you.
So we don't have to send what we already said. I wrote it on them.
You don't have, if there's additional comments that we would need those sent by the end of day, June 6th. Thank you.
All right, back to public comment. Anybody like to, somebody has some verbiage.
I do.
So I did send an email around 12:30 this afternoon to committee members. There was 2 written public comments that were submitted and it was sent out a little late. I do apologize. We did have 1 person pre-register with public comment. I do see them on here. So that would be Christina Terabicos. If I said that right, if I said that wrong, I apologize. I just authorized your microphone. Are you able to turn on your microphone, Christina?
There we go.
There
Can you hear me
go.
now?
I can hear you.
Awesome.
You have 3 minutes.
Thank you. Good afternoon, members of the committee. My name is Christina Terabicus, and I'm here today as a concerned state employee to request a formal review of the prescription drug formulary currently provided through CVS Caremark, specifically regarding the upcoming removal of Zepbound from coverage. State of Delaware currently relies on the CVS Caremark standard formulary for employee prescription benefits. The one-size-fits-all model offers no flexibility or alternatives for employees, leaving medical decisions at the mercy of a single pharmacy benefit manager, not by our doctors and not with input from those directly affected. As of July 1, Zepbound will be removed from coverage and existing prior authorizations will automatically transfer to Wegovy. While both medications are FDA approved and similar in cost, Zepbound has been shown to result in a greater weight loss, better control of related conditions, and fewer side effects. For many patients who didn't respond well to Wegovy, Zepbound was the first option that actually worked. It is not a safe or nor equal substitution. It's a disruption in care and a high cost to employees. More importantly, this is a removal of preventative health care. Zepbound doesn't just support weight loss. It reduces long-term risks for diabetes, cardiovascular disease, and other chronic illnesses. Illnesses that long term increases taxing costs for the state. When I raised these concerns to various members, I was told the formulary is determined by CVS Caremark, not the SEBC. But this isn't quite accurate. In fact, the response highlights the problem. Delaware employees have no voice in this process. That's why I urge the committee to consider one of 2 actions: transition to a custom formulary that restores coverage for medications like Zepbound, or explore alternatives to CVS Caremark as the state's primary state's benefit manager. Other states have done this. The North Carolina State Health Plan works with CVS Caremark under a custom formulary that still covers Zepbound. Likewise, the NY SHIP Empire program in New York State has confirmed Zepbound will remain covered under its own custom design, saving their state employees thousands of dollars by providing the superior drug care. This committee's mission is to, in part, offer the state of Delaware employees adequate access to quality health care that produces good outcomes at an affordable cost. However, removing Zepbound contradicts that mission. It limits care, worsens outcomes, and silences patients. I ask you to initiate a formal review and take the steps necessary to protect our health, our choices, and our future. Thank you so much.
Thank you. Next, I see Stephen LePage. So let me authorize your mic. You there, Stephen?
Stephen, you should be able to unmute your microphone.
I sure can. Let's try. Are you able to unmute now, Stephen?
Yes, I can.
There we go.
So mine's going to be kind of short. I just wanted to say congratulations to Faith for her 30 years. And I was surprised that no one asked the question from the committee. You know, when Faith changes her hat to retired, is her computer and everything going to slide down that table and go on the other side? Anyway, enjoy your retirement.
Thank you. Is there anyone else that would like to make a public comment today? Please raise your hand. All right. Thank you, everybody. I don't see any other hands raised.
Okay, so I guess I get what I say, so I just want to congratulate Faith again. She has done a fantastic job. This is my second tour of duty with Faith, and so I wish her the best. So, thank you.
I appreciate everyone's warm wishes. Sure, we'll watch that again.
So I'll entertain a motion to adjourn.
So moved.
Second? Second. Right, motion adjourned and motion passed. Enjoy your weekend.
Take care, everyone. Thanks so much.